and those with lived experience. Throughout the conference today, you'll hear from a diverse group of experts, leaders, advocates, partners, parents, all committed to the cause of improving outcomes through an unapologetic lens, through both a race equity framework as well as practices throughout to elevate the voice and partnership of the true experts, those with lived experience. We invite you to send us questions, give us feedback. We hope that you just walk away with the renewed spirit of continuing this journey of improving the lives of families, and specifically Black families in the child welfare system. With that, I want to turn it over to a fellow board member, Lisa Thorpe Vaughn, for our opening prayer.
Good afternoon, everyone. Can we just briefly bow our heads? Lord, we just thank you for this day. We thank you for an opportunity to just come before you, God, and share information, God, to share our lived experience, but more than anything, God, to be processed from trauma to triumph. We pray, God, even now, Lord, that in our process, that you would give us grace in our ability to just be able to come and seek more information, God, as we process others. We pray for your wisdom, your knowledge, and your understanding, God. Activate us in our communities, activate us in our homes, that we might fulfill your will and accomplish the task at hand. In Jesus' name I pray. Amen and amen.
My fellow brother in the work, Mr. Leonard Burton.
Hey, Doc, how are you? Good morning, good afternoon, Black people and other non-global majority people who may be present. Thank you for being here. I appreciate the opportunity to give a greeting and forward as we have this discussion to process from trauma to triumph. And there are a few points that I want to quickly make as we go into this important conversation. It's clear that traumatized people traumatize people. If you've been traumatized, there's a likely chance that you also perpetuate trauma, and not intentionally, but by the fact of your own experiences. And but we also know that healed people heal people. And so as you have become healed or on this journey of healing, you can also help others heal. We have to declare for our healing against capitalism, against racism, against anti-Blackness. For those of you who know me, I usually just go right in. You know, for those who don't, introduce yourselves. I'm introducing myself to you for the first time. But we can't be caught up in building and reforming systems without our eyes focused on creating a beloved society where poverty, where harm, where hunger, homelessness, surveillance, separation, surveillance, and subjugation don't exist. I remember Sandra Jackson, who recruited me many years ago on the BACW board when I once served on the board. Sandra always admonished us that and reminded us that you really won't become an administrator, a Black administrator in child welfare until you've been fired or unceremoniously let go from one of these draconian public systems. So I challenge you to do the work that you do honestly. And as one of my mentors, late Reverend Jim Bevel, once said, that leadership is the science of being honest and paying the cost to be honest. And so there are times when you have to speak truth to power and be comfortable with speaking truth to power and not worry about where your next paycheck is going to come from. That's how we get caught up in the capitalism trap. Our community cannot afford us to have us sitting in these seats with our names on the marquee collecting government paychecks while our families are being torn apart in the name of the Trojan horse, child protection. So I challenge you to take the risk, And I know that there's a great deal of privilege involved in taking those risks. As a former administrator in child welfare myself, I've been both fired and unceremoniously let go because I refused to sit silent when I was seeing harmful ideas and practices and policies taking place. When I would say that that we can no longer play games in the midst of war, and that there's a war going on against our community, against our people, against our children, that we can't play games. We can't afford to sit around and say I'm playing the European game in order to make changes. There's no game being played. There is a war against the survival and the value of our families, and we must remain vigilant in not allowing us to be lost in those wars or battles. So I also challenge you to resist being the exceptional Negro in the room and fall into that trap that white supremacy has set for all of us. Instead of being caught up in this capitalist wheel of trauma and selling ourselves out on the altar of expedience, rebuke racism and harmful system that sees us as cogs in a bigger machine. You must make your bottom line the people you serve, and know that as a liberated and healed person, you too can liberate and heal the people around you. Thank you. I appreciate you and look forward to the conversation.
Good afternoon and good morning to some of you. Thank you, Brother Burton, for launching us off and propelling us forward. I always enjoy your presence. I always enjoy your partnership. So once again, I'm Keith Bostic, and I'm the president of VACW. And the board and I welcome you to the 2023 annual conference. And this conference is framed around Trauma to Triumph, a journey through the lens of African-American children, families, and communities, and lived experts. VACW, since its inception in 1971, has always been unapologetic in its voice, in its advocacy, in its action, and its commitment to transforming systems, transforming institutions that are impacting negatively African-American children, families, and communities. Through that voice, through that unapologetic voice, and through those unapologetic actions, we have sometimes faced significant hardships, challenges around our position and around our stance. One of the reasons we believe that, and why we're unapologetic in our efforts around African-American children, families, and communities, is that our children, families, and communities have been overrepresented in not only just the child welfare system, but overrepresented in many of the other institutions. And so we believe that if you solve the issues and address the issues impacting those that are most disproportionate, then you solve and improve the outcomes for all children, families, and communities. And it goes back to centering around humanity, and that we all need to move forward and see ourselves as equal, see ourselves as ample, and that access is provided to all. And that we do that in a manner by which we are inclusive of those who we serve, those who have lived expertise. And so it's with that that we are hopeful that you gain some knowledge, some understanding, and as Leonard indicated, a commitment, a renewed commitment to being bold and courageous about the actions that you take. I hope that you also will look at the fact that some of you sit in jurisdictions where there is a frontal assault on things such as the eradication of African-American history, the silencing of any statements and comments around issues that might be impacting African-American communities, issues around poverty. And we get it. We get it, that some of you will be challenged in your will. But at the end of the day, you will have to assess, where is your willometer? Is it to the left? Or is it low? Or is your willometer high? Our families, our children, our communities are looking forward to you and your leadership around having a high willometer, because your will is going to drive your practice. Let me say that again, and I'll add something to it. What you believe is going to drive your will, and your will is going to drive your practice. So let's have high will so that we can have great practice for those that we serve. The other thing I want to share with you is that BACW is also committed in ensuring, supporting, and developing and sustaining African-American leaders in child welfare and human service agencies. We do that in a number of different ways, where we provide leadership training, leadership support. If you have not heard about the Sankofa Leadership Institute, you will, and there'll be information provided to you. I ask you to sit back, hear from a number of providers, presenters, advocates today who will talk to you a little bit about how trauma has impacted African-American families, to what the data may be saying or showing, and movement around with practice and what those outcomes look like. And then you'll also hear from some of who I call the greatest artists ever. And those are from the voices and from the lens of those who've had lived expertise, lived experiences. And so with that, I ask you to sit back, engage, participate, and enjoy the 2023 BACW Annual Conference. Thank you. And now I want to turn it over to my illustrious colleague and fellow board member, and that's Dr. Sherry Simons Horton. Dr. Horton will take it from here and lead us through our next phase of the conference.
Greetings, everyone, wherever you are, and welcome again to our BACW Conference 2023, From Trauma to Triumph. I'm honored on this day to introduce our keynote speakers, and then followed by our lived experience and expertise correspondents. And I'll start with Ms. Beverly B.J. Walker. Ms. B.J. is the president of In the Public Way, Incorporated. She was also the previous commissioner of Georgia's Department of Human Services and Illinois' Department of Children and Family Services as director. Ms. Walker offers passion, leadership, and management experience from over 40 years of work in human services and education. She has successfully led reform efforts in state and local government and played key roles in promoting and supporting change and innovation in both the private and not-for-profit sectors. Over her illustrious career, BJ has been a change agent in education and human services. A public official since 1995, she has served in the administrations of governors in Georgia and Illinois and the mayor of the city of Chicago, managing portfolios that at times included child welfare, public health, behavioral health, and developmental disabilities, TANF, child welfare, SNAP, Medicaid, eligibility, aging, and child support. She's been busy. At Deloitte Consulting LLP, she served for 5 years as a managing director in their public sector practice. After her effective change management work in Georgia, she was featured in the first edition of Franklin Covey's #1 best-selling business strategy book, The 4 Disciplines of Execution. She was asked to author the foreword of the second edition published in 2021. She now manages a consulting practice in the Public Way, which serves as a platform for supporting change management efforts focused on major public sector issues. In 1993, BJ was awarded a prestigious year-long resident fellowship with the Annie E. Casey Foundation. BJ has a master's degree in American history from Northwestern University and a BA in religion from Mount Holyoke College. She has served as a board member for over 15 years with the National Algebra Project. She is a board member of the Stewards of Change Institute in Washington, D.C. and at Chapin Hill Hall in Chicago, Illinois. I'm going to turn it over to Dr. BJ Walker without any further ado so that we can hear her presentation. Thank you so much, Ms. Beverly, for being here.
Thank you. And Sherry, I'm gonna tell my folks that you gave me a doctorate. I appreciate it. Appreciate it when you get a doctorate.
Honorary, come on.
When you get a doctorate from your peoples, then that's all good. But good afternoon or good morning, and I'm really grateful for the opportunity to speak. When Keith called me and asked me to speak, and I realized it was the Black Administrators in Child Welfare, I had two choices. One, act like the Black wasn't there and just talk to administrators in child welfare. Or number two, speak to it. So I chose to speak to it. And the reason why is because if you're Black every day in this country, somebody we know and care about wakes up just a stone's throw away from catching some kind of case. And because we work inside and on behalf of these systems and how they show up in the lives of people, we risk becoming complicit in how these systems might show up as layered on traumas in the lives of people who are already treading water in the deep end of life. Because here's something that has hit me hard in the last year. How did Black men beat another Black man named Tyree to death for no good reason? Yeah, I know they were cops, but their mamas and their daddies and their grandmamas raised Black men. So when I saw that story out of Memphis, I couldn't believe it. And I kept saying to myself, 5 Black men did what? They let a system call them the name of scorpions, and then they let that name make them forget who they were and what they knew. Forget that back at the house, in their family, they know somebody like Tyree. They got Tyree back at the house, and that they should have known better and they should have done better. So everything I want to say to you today springs from that right there. 5 Black men forgetting who they were. Now, I don't want you to think that I think being Black makes us better than others, but when it comes to the traumas that children and families face, it should make us think different and trust and act on what we know, and not what somebody else who doesn't know tells us. And what we know should show up in our leadership. Our birthright gives us a particular assignment. We are more than administrators. And we have to be, because the current systems depend on not being challenged, not by the Tyrees in our neighborhoods and not by us. So we, those of us who are Black and in child welfare, we are the last line of defense for many folks, for many children, for many families. And in case you think I am really just talking about Black folks, I'm not. Because know this and know it well. When we ask systems to be a hammer, they will look and find nails wherever they can. We Black folks just might be the first ones in line. But folks like you and me, we do have an insider's advantage. We cannot afford to see through a glass darkly. We not only know people who need these systems to act differently, we know this system. We are well positioned to challenge it. So I want to talk about 3 things today to really bring us into the space of moving from trauma to triumph. I want to first talk about what we should know about the children and families our systems are seeing every day. Second, I want to talk about what we know about these systems and how they do what they do or how they do what they don't. And thirdly, I want to spend a little bit of time talking about how we can challenge both ourselves and those systems to offer children and families not more trauma, but the possibility of real triumph. So first of all, what do we know about these families? Well, we should know that in spite of the prevailing narratives, these families and their children are not just waking up every day simply wallowing in inexplicable traumas. They're not walking around trapped in some kind of murky and clueless ACEs scores. They are living in survival and hustle. That's what they probably going to call it. Something that those of us who may be living inside even the flimsiest of privilege have a tendency to undervalue. Like Celie tells Mr. in The Color Purple, I may be Black, I may be ugly, but know this, I'm still here. We should know that for some folks, risk and crisis is a constant. That what we in our system see as not succeeding, they see as trying their damnedest to do what they need to do. We should know that because folks got cell phones and big TVs and pay for things that we see as frivolous, doesn't mean that they could have substituted those things for stable housing and quality health care in their neighborhoods, or adequate child care that is available when they need it, not when somebody else wants to offer it. Some folks only have a deep end, and it is ever present. They have to be conscious of the fact that it could devour them at any time without warning. We should know that they know folks like the girl Mary down the street who are far worse off than they are. So when our systems come knocking on their door, they wonder how we stepped over Mary to get to them. We should know that lack of cooperation, anger, and vocal frustration, cussing us out by adults does not mean they're hiding something and deserve to be punished to the fullest extent of our authority. It means that they know they're not going to get a break. So for the sake of their own dignity, why not go down fighting? Like my mama used to say, you may not win, but they sure better know you was in a fight. There's a glimmer of triumph in that. I mean, we all know that. There's a glimmer of triumph in that you had a fight. Now, I didn't win, but you know, and you can walk around with your chest out around that. But the thing we should absolutely know and never forget is that if we're not careful, that could be us. So, given what we know about children and families, what do we know about these systems and how they show up as merchants of trauma in people's lives? Well, we know that more often than not, there is little or no evidence to support many of the decisions that get made about families who come to the attention of a child welfare system. That our decisions are driven by rules, regulations, and policies that have already made assumptions about people they don't know, they don't understand, and have no reason to value. We should know inside these systems that truth be told, the child welfare system does not like adults. One reason is because when we get asked to deal with adults, we're looking at them through the lens of a maltreatment report. And we're not asked in our work to honor the journey they have of survival, or we're not asked to care about their struggle or their hustle. What we're asked to care about are rules, service plans, assessments, and timelines. And I assure you, nobody, and I mean nobody, ever got fired for not listening to and paying attention to parents. We know inside these systems that the definitions for terms like risk of harm, neglect, and safety, in spite of what people try to tell us, they're not based on science. But they find their origins inside of varying shades of privilege, bias, racism, and exclusion. They're being defined by words, not by realities. We know that there is no common and equitable standard being used to determine the best interests of the child. And that the courts, the GALs, the CASAs, yes, I'm calling them out, the legislators, the judges, they're often exercising personal discretion, which may not align in any way with what is best for the child, and then often runs counter to what the children themselves would say, or what they want, or even what they need. Inside these systems, we know that removal and foster care are often the fruits of a larger and much more poisonous tree. One that is rooted in the historical and structural underinvestment in our neighborhoods, where Black folks, and quite frankly, others of limited economic means, have to live, where we have to be. We know that everybody talks about the checks and balances inside the system, so-called checks and balances is what I call them. That those checks and balances along the chain of decision-making do not operate in an equitable way and are therefore often arbitrary and episodic. And that the inconsistencies that show up every day in the application of policy, not just from system to system, from person to person in the system. I make a decision on a family this way, you make it that way. And the inconsistencies seal the fate of Black and brown and poor families and their children, and they don't have any way to counter it. And we know that our systems do not have what families need. What we have are investigations and assessments, referrals to places that don't exist in their neighborhoods, mandated court appearances scheduled at the convenience of everybody but the family. And when families cannot comply with all this, we don't blame ourselves. We blame them. Just like those scorpions in Memphis, we see what we have been asked to see. So where's the challenge come from? How do we offer children and families the space to actually move from the traumas that these systems inflict on them, from the traumas that our larger society lays on the table? How do we move from those traumas to and the possibility of catching a case to triumph? Well, as leaders inside government systems, we need to become more than what we are asked to do. That's what I meant earlier when I said we are more than administrators. We need to help systems stop seeing folks simply through the lens of their circumstances. The kinds of conditions that unaddressed would inevitably bring you, me, and even the strongest among us to the attention of a child welfare system. In government, we become the merchants of trauma when we do things like give out SNAP, but hold families accountable for not having stores in their community where they can actually buy healthy food. We become the merchants of trauma when we give out Section 8 vouchers, but hold the family accountable for the infestation of rats and roaches in the building that they pay rent to. We become merchants of trauma when we pay for beds for kids in the homes of strangers and are not willing to put those same beds in the homes of their parents and their grandparents and their aunties and their uncles. We become merchants of trauma when we issue Medicaid cards, but hold parents accountable when they can't find a provider who will take it, and when they don't have no car to drive to one that will take it. We need to raise our voices and stand up to the highly annoying habit we have as a nation, where we simultaneously recognize and then trivialize the challenges families face in under-resourced communities, and particularly under-resourced communities of color. Too many folk, I'm sick of listening to them, are spending too much time naming and renaming what trauma looks like, and then fumbling when it comes time to put in place the kinds of policies and funding inside communities that would support triumph for the families we see and the families that live in their neighborhoods. We need to challenge those who are willing to accept easy fixes for what are complex issues faces families. There is no shortage of research and writing. And I ain't got nothing against researchers. I'm just saying, Peter, when he talks later, there's no shortage of researching and writing about the overwhelming traumas associated with racism and poverty. Yet, we're willing to offer families a couple of $100s a month and suggest that we have solved child poverty and changed the trajectory of their lives. Let me be clear though, I'm not saying don't give them no money. I'm not saying that. Everybody can use another couple of $100, but it doesn't materially change your life. And so we need to stop pretending that it does. Go on and give them the $200, but understand the problem is bigger and more complex than that. And too often, we find ourselves as leaders inviting folks to the table, telling them that they are more than what happened to them, and then having the audacity to define their participation by what happened to them. Let's invite folk because of who they are, what they aspire to be, what they know, what they can contribute. Because like Celie, they are the ones who have managed to still be available despite what happened to them. So let me close with a few final words. Even as leaders, you already know that opening up space inside government is not for the faint of heart or the weary of spirit. I can put amen on that. I've been inside and I know, and I've been in the struggle. And some of you on this call, on this conference, were in the struggle with me in various places. But to move families out of the trauma lane into the triumph lane, you got to find ways to color outside the lines. So here you go. A few words of advice. When you're at the meeting, no matter who the meeting is with, be the best and the most persistent question asker in the room. Policy and policymakers are not accustomed to being questioned and challenged. You got to ask You know, you got to ask the questions. They depend on us not asking the questions, just listening and taking the name and doing the work as it's being laid out. When someone says, "Oh, no, we can't do that," we can't do that because the law, the policy, the regulation, something, you can't do that. Always insist on reading what the law or the policy or the rule actually says. I assure you, people will stop telling you no unless they know for sure. And most of the time, I assure you, they don't know for sure. Never do anything substantially different without rolling up along somebody working on the front line. As administrators, we may be responsible for writing policy, but it's the boots on the ground that deliver it. They know more than we do about families and children, and they want to be more than what we've asked them to be. And then finally, keep a lump in your throat. This stuff really is personal. When you are a Black person in America, this stuff is personal. I've never done a job where it wasn't personal. Hold yourself accountable for being Black and knowing what you know, because people like Tyree are depending on us. We cannot afford to grow weary. And I thank you so much for just letting me bring a few words this afternoon. Thank you.
Bravo, Miss BJ. So thank you so much. That was awesome. Inspiring. I mean, I just don't have the words. That's really the best way to get us kicked off. And I'm holding on and probably will borrow, not steal, the Merchant.
It's available for a price.
So thank you so much for that. And we'd now like to follow up with responses from two lived experience and expert correspondents. First, Sharina Parker is the Social Services Administrator for Cobb County Department of Family and Children's Services. She has served in the child welfare system for 10 years as a Child Protective Services investigator and supervisor. She has used her lived experience to advocate for other youth that have experienced foster care by being a founding member of Georgia Empowerment Youth Advocacy Group, being a Jim Casey Youth Opportunities Initiative participant, and participating in youth advocacy initiatives locally and nationally. She is committed to continuing to use her lived and professional experience to continue to improve outcomes, youth and families that are part of child welfare. And I will go ahead and introduce our assistant correspondent as well so that they can proceed with their comments back to back. We have next Angela Braxton. As a national family engagement consultant with more than 20 years lived experience, Angela wears multiple hats when it comes to engagement. Angela has extensive experience in working with state and local child welfare agencies and systems, as well as with partners to improve child welfare outcomes for children and families by establishing and supporting meaningful family engagement and involvement with those with lived experience. This work is focused on the mutually respectful and sustained engagement of families and child welfare system improvement activities at the direct service, supervisory, management, policy, and legislative level. Angela is skilled in building collaborative opportunities that develop and sustain system knowledge of meaningful engagement processes of those directly affected by child welfare and the least likely to be engaged and involved by bringing her own expertise and that of others to the table. Angela currently works with ICF and the Capacity Building Center for States as a family engagement consultant, as well as an independent family engagement consultant to several states to build capacity to engage, embed, and sustain involvement of those with direct lived expertise in child welfare services, programs, and practice to include work with the National Quality Improvement Center on Family-Centered Reunification, with the Innovations Institute School of Social Work at the University of Connecticut, and a member of Thriving Families, Safer Children Design Team. She is a participant of the second cohort of the Black Administrators in Child Welfare Sankofa Leadership Institute. Yay. And Angela is the author of A Woman with an Issue, a mother's memoir of addiction, loss, redemption, and recovery, published in 2006. I'm super excited as a qualitative lived experience, not myself, researcher, to bring these two presenters forward. I appreciate you so much, and give us your words of encouragement. So I'll give you the floor and start with Ms. Parker and follow up with Ms. Braxton. Thank you.
All right, awesome. Thank you guys for allowing me to be here. I'm super excited to participate in this, but I'm also excited to finally be able to have an opportunity to start off by paying homage to Ms. Walker. Ms. Walker, it's been a long time since I've seen you, probably since around 2005, but I wanted to say thank you for your unapologetically leadership. Because during that time, you know, I was coming out of or experiencing trauma as being a youth in foster care, trying to find my voice. And I would say, you know, through my journey of being a child welfare professional for 10 years now, I feel like I've accepted your challenge of being more than an administrator. I did not join child welfare because of my trauma or anything that I experienced. I simply wanted to have a seat at the table to be able to use the triumph that I experienced in overcoming, to be a voice to others, to also help educate leaders or just staff in the child welfare system on the things that actually cause trauma to occur, and get them to think outside of the box. Because of course, through my training, I've learned the policies, I've learned the risk management assessments. I was taught, you know, what abuse and neglect looked like based on, you know, what we were trained to do. However, you know, I've always wanted to color outside of that line, because I knew, you know, just being, you know, Black, you know, coming from a rural area, you know, that there's things that our policy just don't understand and they don't cover when it comes to, you know, working with our families. I never looked at it as being a merchant of trauma. So I'm definitely going to take that with me and just reflect on that. But what I've learned is, you know, you have to be just present at the table to help make a difference. Mr. Bostic was my Region 3 director at one point, and he placed me in a rural area where I was the only African-American leader at that time. And I was afraid, because I'm like, oh my God, what is he doing? I can't, I'm not going to be able to make change here. You know, people oftentimes have their mind made up, but I understood why I was placed in that, you know, in that area at that time, because, you know, there's just a lot of things about us that they don't understand at times. And I felt like I had a front row seat in being able to educate them, because a lot of times, you know, they don't understand, you know, Black people, we're just trying to survive. We have different ways of raising and taking care of our children, but that doesn't mean that it's abuse. A lot of the poverty issues, we had to let them know poverty does not mean abuse or neglect. You know, relatives may be on drugs or they may be experiencing some things, but just because they drop their child off with another family member doesn't mean they're being neglectful, they're surviving. Because way before there was a child welfare system, families figured it out. So I'm always that person at the table to get people to think outside of the box, to ask those questions that no one would ask, to challenge people on their way of thinking when it comes to serving our children and our families. So I really wanted to thank you for your insight. I took some notes. It was hard to keep up with a lot of things that you were saying, because everything was so good. I felt like I was going to church this morning, but let me go back. I think the big thing that I took from your message is just making sure that I am encouraging more people that look like us to be at the table, to be a voice. Because a lot of times you'll see, you know, us as case managers, but you don't see us as, you know, leadership directors at the table that's actually being able to influence change and being able to, you know, speak up and not just go along with whatever policy says, and actually challenge the system to say, hey, is what we're doing appropriate And was that removal necessary, or did you look at, you know, why, based on their culture or just the way we're raised? Did you look at this and decide, was this an appropriate, you know, decision for you to make? So sometimes it's not always easy. You know, we get labeled as being defiant or aggressive or sometimes a hostile leader, but you have to be willing to be that person at the end of the day to not continue to cause more unnecessary trauma. I think I covered it all.
Well, thank you, Ms. Sharina. We really appreciate you sharing your experiences. And now I'd like to turn it over to Ms. Angela Braxton to give her remarks.
Woo! Hello, everybody. Miss BJ, I have been following you and consistently reading your articles. And I have to say that a couple of times it brought tears to my eyes because I was wondering, where was Miss BJ when I was going through? And why didn't I have a Miss BJ in my life at the time? And how things may or may not have been different. You sparked something in me when you spoke about the police officers in Memphis, because I personally, you know, I'm in my 50s, and when over the last few years, when the issue arose again around race and the disproportionate numbers in child welfare, to me, I thought that's always been that way. I mean, my experiences as a parent date all the way back to the early 80s and then into the late 90s, where I lost my two younger sons under the Adoption and Safe Families Act during that time. And I was literally a year and a half clean and sober when I was led to believe that relinquishing my rights to the two youngest was the best thing for them. And I also believed at the time that their placement for adoption was going to be a particular place, and found out that that was a lie, which led to, you know, a 3 and 4 year old boys languishing in foster care and going from foster home to foster home, 8 to be exact, within a 9-month period before they were actually adopted. And then looking back at my 4 oldest children being removed in the 80s and all the trauma that I have to acknowledge, you know, that happened prior to their removal and at the onset of removal, was never really addressed by my children in any way. Or I think there may have been some services provided for them to be able to process that. However, I think how we as African Americans, a lot of the time, we think we don't need mental health. We think we don't need that support around that. And I think that's that fear that my family, who did adopt my 2 older or 4 older children, I think that's what they were experiencing due to their experiences that they had with child welfare. But I'm going to take it back to, because you made me run and get my little paper I wrote. I'm going to take it back to the officers, because as I said, I really struggled with how they could do that. How do you do that? And I believe, just as I used to question, how do Black social workers work in child welfare and take our kids? You know, I used to question, how can they do that job without making every effort to engage with and include families in the process of whatever that outcome ends up being. But I ended up, because I questioned, you know, my own ideas around race and how I show up as a Black woman during that time. And I had to look at it as what I kind of call the conditioning. And I see that as that cultural conditioning, you know, that process through which we absorb and interpret influences, norms, and messaging from our environment. And I believe that people genuinely translate that into acceptable behaviors, you know, into what we believe is acceptable behaviors. It is cultural conditioning. And I also believe that this conditioning occurs within families, communities, the places we work, and each family, no matter the race, creates a culture in which they live. Each community sets the tone for what is socially acceptable and culturally acceptable in a community. Then there's the systems who serve families, and obviously law enforcement is a system. And they too have created a culture of what's acceptable. And then it's further defined and developed through that organization's policy. And as you spoke earlier about all the policies and practices, that policy drives practice. And I just feel like for all of us, and I know including myself, that it is so important now more than ever, especially in our current climate, political climate, an environment around racial equity and racism, that given every opportunity as someone with lived experience, that we are speaking up, and we're speaking up from our own place of experience. It's important for me as a Black mother to be able to do that. And because no matter how successful I was or was not with my child welfare cases, I know that systemic racism was definitely a part of my entire situation as a whole from the beginning. So that's why I keep showing up in places and spaces to help those who come behind and alongside me. My children are adults now, and I still, from time to time, see that trauma, that unaddressed trauma come out in different situations. And they're grown with kids and husbands and wives and families of their own, and very successful in spite of, you know, what they went through. We've reunified since. And as you mentioned earlier, you know, we show up Black every day. And I know clearly that I am not an expert on racism. However, I can share about how racism has affected me and my life and the life of my children when it comes to systems and organizations that we all have to, at some point in our lives, we're front-facing these very organizations that were never created for us in the first place. In my experience, and as well as over the years, being conditioned plays a major role in how we respond to that systemic and structural racism. When we talk about equity, everybody's on board. Oh yeah, we'll do diversity, equity, and inclusion. But when we talk about racial equity, most white people feel as if they're being called racist. And some may be. Child welfare history clearly shows that it was never created for Black and brown people. When we think about racial equity, we most often attempt to address it through the lens of which we were conditioned by it. it's absolutely normal, you know, for people to balk when we realize that in our own conditioning under these systemic structures, that we played a role in harming sometimes our own children and families as well. But let's be clear that when we talk about racism, racist speaks to the individual, and racism speaks to the construct on which systems are built. And that's what we experience. So when we go and we get jobs in child welfare, and we go and we become police officers, etc., we're working under that construct. Somebody mentioned earlier, sometimes we have to step back and say no to the dollars that are attached to some of these systems in which we choose to work. Sometimes we have to take a stand and say, you know, my integrity and the integrity and the life of a family that's going to come after me is more important than that dollar to me. I say no a lot of times if it doesn't sit well in my soul. And something else that's occurred over the years is sometimes being someone with lived experience and being able to be included on with different organizations or different agencies, it tends to become a competition. I'm in competition with no one when it comes to my lived experience. Because guess what? You don't have that unless I give it to you. You're the only one, I'm the only one that can bring my uniqueness to any table. So why do I need to be in competition with you? I don't need your stuff. I got enough of my own over here. So I'm going to finish up real quick. So we're conditioned by those policies and practice that dates clear back to the orphan train. Yet because it's policy, it must be right. And since I'm practicing policy, I'm not perpetuating racism. And we've all played a role through structural racism. So my take on even beginning to address the trauma that's caused is and around racial equity, that it's going to start with the individual. We as individuals have got to recognize and acknowledge the role that we play, no matter where we are, no matter what system or what situation we find ourselves in, or we'll continue to harm families. We'll continue to do it.
Thank you so much, Ms. Angela. And the panelists, our initial panelists to get us started. This has really been an opportunity, I think, for everybody in the room to, set the stage for where we need to go. And it is those individuals with lived experiences and lived expertise and those that are on the ground and have been on the ground that we need to be paying attention to as how to guide us through how to do this activist work. It's not for the faint. It's not for those who don't want to take risks. And so we have to be prepared and ready. And I just really appreciate you all being here and opening yourselves up to give us something that we need to know. I worked in one of those systems in Texas for many years and was complicit in being socialized to think that removing children was the best way for me to keep kids safe. So I really do appreciate being able to come back and continue to hear stories. And there's more to come. There's more lived expertise and experiences that you all will hear today. And with that, again, welcome again to our BACW Trauma to Triumph Conference of 2023. And as we go forward into our next section, which is around the research, it gives us some context, but also at the end will provide us with some content and information and stories that will help us to really understand the depths of what we need to be doing in this work. So I'll turn it over to my colleague and friend, Dr. Yakisiwe Mitchell. Thank you.
So thank you, Dr. Sherry. Thank you, Ms. BJ Walker. Thank you, Ms. Sharina. Thank you, Ms. Angela. And thank you, Keith Bostic, our esteemed president, who had the vision for partnering with those of us who are administrators and have various types of experience, right? And our lived experts, having them be correspondents and responding to what they hear. So I am just blown away actually by this format. I have the distinct pleasure of bringing in the folks who are going to walk us through what the data say. BACW has partnered with Casey Family Programs for some time. We are partners with Casey Family Programs on the Thriving Families Initiative. We are partners with them in our race equity efforts. And we're pleased to invite Dr. Peter Pecora to share his impressions of what the data show and research on some of the practices that have moved the needle. Our own Lisa Ford is joining him to share that data and that research on practice that has been shown as promising in work with African American children and families. So I don't want to delay their joining us. Dr. Pecora, there you are. All right.
Yes, I am. I'm back online
Thank
here.
you.
I did hear all the presentations. I want to thank BJ and Sharina and Angela for their insights and wisdom. Lisa and I are really grateful to be able to be here today to share some data and some program strategies with everyone this afternoon. We're going to follow this up with a more in-depth discussion session on October 5th at 2 p.m. Keith is going to send out that information. That was a terrific idea he had about let's just allow a little more space for unpacking some of the things that Lisa and I are going to present today. So the information of that, everybody who's a conference attendee is going to receive an invitation to that more in-depth discussion. And we hope one or more of our lived experts will be joining us for that in-depth discussion, and that'll be scheduled up there. So you're also going to get a copy of the handout that Lisa and I are speaking from today. So you'll have that shortly after the conference ends today. And then we'll send out a little 5-page summary of the National Research Agenda for a 21st Century Family and Child Wellbeing System. That's one of the partnerships that National Agenda has with the BACW. So we want to give you a little more information about that initiative as well. So 2 documents coming your way, both very short, but hopefully very informative. What we were asked to do today is maybe set a little national context with some data that maybe you haven't seen, or certainly haven't seen it up through 2021. Because there's some progress being made. This is the from trauma to triumph part. So part of what we're going to talk to today is some triumphs. There has been some progress being made, while there are some serious challenges, as you've heard our speakers talk about earlier today. So in the United States, if you look at the child welfare data from the federal fiscal year 2005 up through 2021, there has been a 23% reduction in the use of out-of-home care. There has been a 61% reduction in the use of group care, which you've heard some of our speakers refer to as such, in many cases, a destructive influence. there has been, I mean, a 61% reduction in group care, a 10% reduction in the number of American Indian Alaska Native children in out-of-home care. That group has stubbornly, that statistic has not moved in a way other ethnic groups have benefited. But there's been with all those decreases though, there's been no appreciable increase in child maltreatment recurrence rates. So the critique is, oh, if we reduce the number of children in foster care, child maltreatment recurrence rates are going to just climb and increase because those children won't be safe. Myth, as BJ knows so well from her work in so many states. For African-American children, between 2005 and 2021, there has been a 47% reduction in the number of Black children in out-of-home care. It went from 154,000 and change, we'll get you the exact numbers, down to 82,000. 154,000 down to 82,000, a 47% reduction. And we'll get these statistics right out to you. We've got the actual references for all of them for you, so you'll have that. Between 2005 and 2021, there has been a 72% reduction in the use of group care for African-American children. We know children of color get group care instead of high-quality mental health services. Leonard, in his work and his history and his work with Casey Family Services and the Jim Casey Opportunities Program, I know has advocated and spoke to this issue. It has been a travesty. Thankfully, between 05 and 21, there's been a 72% reduction. Do we need to do more? Absolutely. But it went from 28,000 African-American children in group care down to 8,000 children in 2021. That is a huge decrease. And that didn't happen overnight, and it sure didn't happen without your efforts and other efforts by other African-American leaders. If I can share my screen, I will show you a couple of other statistics that, again, are on the handout. It looks like I'm sharing screen, and I know these numbers are a little small, but then I'll just do the highlights for you, and then, you'll have Lisa and I and Keith and Kizue worked on this, so we'll get you this right after the conference today. But this is for just in the last year, because if people are wondering what happened with the pandemic and how are these systems recovering, we wanted to just give you a one-year snapshot. The good news, entries into foster care are continuing to decrease across all groups, including an 8% decrease in the last year for African-American children. That's in foster care. Children in out-of-home care, which is group care and everything combined, also decreased, and thankfully for African-American children as well. Group placements are continuing to go down. People are seeing it. The Family First Law is reinforcing it. Thank goodness people with lived expertise are continuing to share their outrage. And for African-American children in that last year, 12% continued decrease in the use of group care. I've highlighted in red a couple areas that are still challenges for us. We're seeing a decrease in children exiting care. Some of the systems we think are overloaded. They've had staff turnover in some of their best staff, and children are not exiting as quickly and in as higher numbers as were in the past. So that's something that I know as advocates we're going to be watching out for, but we wanted to give you the data from which you could advocate with. And so those are the two areas then red that we know are concerned, and that is exiting for any reason decrease. So kids are getting stuck in care a little bit, and the exiting to permanence instead of leaving care as an emancipated adult or running away. Exiting to permanence in a good way has decreased slightly. Lastly, the number of children aging out without finding permanency, that is continuing to decrease. People really are getting it that children deserve a forever home, whether that's with mom and dad or with an aunt or uncle or some type of fictive kin or an Indian clan member. That continues to go down, thank goodness, and it's decreased for African American children and white children the most. 9% decrease in kids aging out of care. That's good news. So we wanted to share that good news for you around this, the statistics, and give you added information to argue or advocate for things that maybe still need to be worked on. So to recap, we see two areas of concern: the continued over-reporting of some Black children and other children to Child Protective Services for situations that likely do not require a CPS response. You heard BJ speak to this. And secondly, we're seeing delays in achieving permanency for some Black children. So those are the two areas, I think, as Lisa and I looked at some of the data with Ikezue and Keith, we said we wanted to highlight those for you. Lisa's now going to go to speak to another section of this very brief handout to highlight what's some of the current research telling us about serving and supporting African American children and their families. Lisa, turn to you.
Okay, thanks, Peter. I'd like to say greetings to everyone. I'm truly honored and thankful to be a board member of BACW. I remember attending and being a participant in many conferences over the years, so I'm glad to actually be a part of the board. Also, and to participate on this panel with Peter, a national expert in child welfare research. So I feel honored to be here. And as many of the panelists have affirmed, our will, our leadership, the lived experiences of each and every one of us, the data will help drive and challenge many of our practices in child welfare. I've worked in child welfare and social services, nonprofit agencies, and even behavioral health agencies in both Pennsylvania and Maryland. As an administrator in both jurisdictions, I have considered it my responsibility to advocate for the rights of children and families and the impact of trauma, intergenerational trauma, due to structural racism. Today, I have the honor of discussing and adding more detail to the practice data and current research impacting African American families. As a leader, an individual, a scholar, we know that contact with child welfare systems is very common. And actually, I can also share this. That's okay. So you can follow with me. Okay. Alrighty. Make sure I get the right screen. Have it up. Are you guys able to see this? Peter, do you mind sharing your screen on this with section if you don't mind? Okay, sorry. All right. It's so important. I want to make sure I'm articulating it correctly. So, contact with child welfare systems are very common, as we know. In the US, 37% of children between ages 1 and 18 will experience a child welfare investigation. The likelihood of children of color is dramatically higher, and half of the African American children will experience a child welfare investigation before the 18th birthday. 12% of those children will experience a confirmed case of child maltreatment before the age of 18. State child abuse and neglect reform is urgently needed. Some states are already doing this. When those outcomes for family and children are positive, they can also be considered as models. So as we talked about in the follow-up session, we can probably look at some of those states' jurisdictions and how they are impacting those outcomes. With better family supports, some of the substantiated child neglect situations could have been avoided. As a practitioner, I remember many times that if services were connected to families in the community or in their local area, many families didn't necessarily have to be referred. The caution is that neglect is real, right? And children are being neglected, right? It's not necessarily physical abuse. 69% of those children are reported to CPS for neglect, but it's more physical neglect and medical neglect and other forms of neglect versus physical, actually injuring the children, causing serious harm. There are major opportunities for child welfare agencies to work with those 5 different sectors, as referred to by Dr. William Bell from Casey Family Services, and that's the government, right? Interacting with government, philanthropic, nonprofit, which is a civic, grassroots, faith-based social service agencies, and other community organizations. The business sectors and residents in the communities, children and the families that are most adversely impacted. Mandated reporting into CPS has been untested and is a flawed approach to practice, with too many families, as Peter indicated earlier, are being referred to CPS who do not need that type or level of intervention. In 2020, Child Protective Service agencies received reports of maltreatment involving 7 million children. Of those, only about 1 million children ultimately received some sort of service or intervention. The others were closed or not necessarily going to the higher level. Put another way, for over 100 children who came to the attention of the system through a hotline call or referral, only 15 saw some sort of intervention. Wow, 15 of 100. Okay. What I also would like to add is that data does raise the important question about systems and how they function. Policymakers should consider, because what does a CPS agency, a highly functioning CPS agency, really look like? It has a well-functioning agency, has a value and embraces parents as essential partners and engages them in a supportive manner to ensure child safety. Policymakers should hold child protective agencies accountable for ensuring that children are never removed from their families in response to a non-safety related concern. When children need to be removed for their safety and placed in foster care, the research does indicate that children are best served when they are placed with their families, relatives, or chosen kin. So in highlighting, the child welfare system needs a lot of reform, and there is research data that's out there to support and interventions and programs and practices that have helped improve the outcomes for children and families. So as administrators, leaders, lived experts, and scholars, our task for today is to go back to our organizations and advocate and learn about those different initiatives and different practices and policies so that we can advocate for them to happen and occur in our agencies for our jurisdictions. Thank you. I'm going to refer back to Peter.
Thank you so much.
Sorry, I had to unmute. So we're going to just stay just so that we're staying on time. We've got time for our lived experts to provide some comments, just close with 2 other observations there. And that is just building on what Lisa mentioned. PJ and other folks spoke to this. We've got to address the economic, housing, healthcare, and other insecurities that families are lacking, along with some of the social isolation that they experience. And it's disentangling. That's what Black administrators, I think, in child welfare, is part of a strong advocacy group that we need to advocate for disentangling these root causes, so that we can further drastically reduce the involvement of CPS in the lives of families of color in the United States. Fortunately, people say, "Oh no, we don't know what works." That's BS. And I think it's part of our strong advocacy. And what we wanted to provide to you in this handout is that thanks to the hard work of people like Carl, I'm going to block on, not Erickson, I think Mavis, who founded Wraparound Services, the Kaleidoscope Project in Illinois, and other African-American pioneers, we have strategies that can support families and are very good and very effective with families of color and African-American families when they're provided by a culturally competent, well-trained and coached staff member or parent peer advocate. That we know these things work, and we wanted to give you this list so that you'd have it at the ready, that there are strategies that are out there that really that our African-American colleagues have said, yes, we need more of these. We need these more readily available. And they include things like family finding and family group conferences, which we stole from the New Zealand Maori. Very important culturally competent practices. Home Builders was done in the Bronx, as well as all across the United States. Kinship Navigators actually started out modeled after some of the African-American informal supports that we've had for hundreds of years in this country. The Mockingbird model was co-designed with alumni of foster care. So there are a whole range. Use of veteran parents for support and guidance, as some of our guest speakers today have served in those roles. Safety mapping, rapid permanency reviews, cultural brokers. We know more now how to support families and child welfare than we've ever known before, thanks to a lot of advocacy and a lot of research that's finally built up. So we're saying our ending point that Lisa, Keith, and Yakizi we wanted to make was, we need more scale up. We need more consistency. These are good interventions that ought to be in every child welfare agency, in every community, not just in a few suburbs or a few well-endowed child welfare agencies. They need to be available to every family in America. And that's part of our problem in child welfare. We get good ideas, good strategies that people have worked so hard, like Carl did with the Kaleidoscope program, and then we fail to really scale them up and make sure they're available to all the families who need them. So that's how we wanted to end today. Before again turning the floor over to our experts, to Corey, I believe is going to speak next. And we wanted to let you know that the handout will be made available, and we will be having a follow-up session after this workshop on October 5th.
Thank you so much, Peter and Lisa, for sharing that information. We did receive a question in the chat about whether or not the reduction meant that African Americans are abusing their children less. And I think a part of the issue is that because African Americans are disproportionately reported, screened in, and stay in care, there is a perception that there is more abuse in the African American community. But we have always, at BACW, we've always countered that assumption, right? And we have produced reports and research to back that up, right? But the question always becomes, whose voice is heard, right? Whose research is highlighted? And so what I will say to our guests is that, no, it doesn't mean that African Americans are abusing our children more. As a matter of fact, it's just not the case. It's not the case that we're abusing our children more. And that question highlights the reason we have to continue this struggle, right, of keeping our families safe and supporting as opposed to reporting. So I don't want to take time away from our lived experts. I'd like to introduce Takoria Jones, who is from Be Strong Families, a National Parent Cafe leadership team representative out of Columbia, South Carolina. And Jamar Barnes, he is actually a social worker. He's a foster care alum. He's out of Baltimore County Department of Human Services, and he's also a part-time licensed mental health therapist and travel social worker. So I welcome and look forward to hearing from our correspondents, Jamar and Takoria.
Well, thank you very much. And I'm definitely over the moon to be here today. I just want to jump right in, right? When I hear the term good news, it always gets my attention because for me, it always determines who decided that was good news, right? And especially talking about data, because nothing about data is arbitrary. When data is put together, it is put together on purpose, with meaning, because it has to be consistent in order to be considered data. So when I'm looking at this, I'm a little bit concerned that we went back to 2005, right? So the 16-year piece that we're looking at, but are we also considering how many children's homes closed and what happened to these youth? Because I am convinced that they ended up in the juvenile justice system. Yet we don't track this kind of out-of-home placement, although we know good and well that it is used as an out-of-home placement. So when I see these kind of data points, I'm always concerned about, are we just going to say that's good? Or are we going to really understand all of it? Because there's no way, right? There's in my head, a 47% reduction. And then on the next page, 50% of us are still getting cases. And the decrease in exiting, right? The permanency issue. So what I would like to see from data for it to feel like it's doing something, because just like, I believe that was Sister Angela that said, hiding behind policy, it's easy to hide behind data. It's really easy to hide behind data according to how you script it, according to how you choose to define the parameters that you are using in this data, right? So we must be very, very cognizant, because especially lived expertise, they know that we have feelings, and they know that we help systems reconnect the humanity, but they forget that we are often genius. We have so many other insights and capacities to look at this work. So we bring our stories and that value of the emotional human connection, and we bring perspectives and intelligence and genius to this work as well. So I'm just really concerned about, when we say good news, how can we prove that is really good news? And if we're really looking at it, we need to disaggregate every piece of percentage that comes out of this work. Just tell me, okay, so 37% of children in the United States, how many of those are Black? I want to know these numbers, and these numbers should be right there. If there's a percentage about children and we're really trying to get some things done around changing things, show me all the information. Because the least of these isn't just a term. So if we're going to keep talking about Blacks are overrepresented, keep showing me that. Just don't turn the dial back to children. Like, keep the dial on what's going on with me and people who look like me, because that's where we are right now. I cannot help but to continually be reminded of the space that is not held for families. And I see this data, and I appreciate, high functioning child protective service agencies and the 1 million children, who ultimately, I'm sorry, that's the 15 out of 100. But what about the families? How can we continually talk about supporting children without strengthening their families? Family data and children data need to be together, because we are not going to be able to separate that understanding and do what needs to be done as far as changing things. Now, one thing I really appreciate about Brother Keith Bostic and the BACW is they recognize that we come with a lot, right, Jamar? We come with a lot. So we are correspondents. We're out in the field. This is real. Right now. This is happening right now. And when social workers come in and they're representing, they're doing a little bit of that that trauma sharing, that I'm sorry, the phrase is gone, because it struck me so hard. I was like, oh, that hurts, right? Because they're seeing my people and they're seeing us, And they come in and they don't recognize their privilege sometimes. They don't recognize that that Louis Vuitton pocketbook, yours is real, mine came from the flea market, right? You come in here talking about your vacations at Cabos or whatever, you wearing your red bottoms, I don't know, but you coming into my zip code and we don't have a grocery store. Remember how you talk to us, right? Remember how you see me. I'm just a person just like you, right? And we are all in this mess. Every last one of us, black, white, brown, and this world is a whole mess and we are all slapped in the middle of it. So what are we going to do to make sense of it? And that is our responsibility. And so the data's got to be right. And then it needs to tell me the whole story, not just the good news. I want to know the whole story. These numbers came from our facts, our experiences, our traumas. Give me my numbers. Show me myself. Show me my community.
Takora, that was Yoga Flames. Oh my God. Where would I be without the Black woman, right? You absolutely killed that, Takora. I don't even know how to follow that, but I do want to begin with, I wanted to lead with me being a foster youth alumni. I have a big issue with being referenced as lived experience. I'm just going to be controversial here. I'm just going to throw it in there, throw the grenade in there. I think it was a label that was conjured up and given to the people without permission from the people that it's referencing. It also diminishes the unique experience of each and every one of us with lived experiences. That's why I exactly put on my bio that I'm a foster youth alumni. I actually come from the system. I come from the valley, not here to sit on it. I'm not here to sit on any mountaintops. What is the etymology of lived experience, right? What are we referring to? If you think about our pioneers, if Harriet Tubman was only known to be a nurse, I think they kind of professionalized and romanticized the label of lived experience. But if Harriet Tubman was recognized as a nurse, or if Paul Robeson was recognized as a lawyer, or if Ida B. Wells was only recognized as a journalist, what would we be at today? We don't highlight their unique experience, right? Harriet Tubman was a freedom fighter. Paul Robeson was a Renaissance man. Ida B. Wells was an advocate. And that's what I want to encapsulate when we talk about lived experience, right? I'm a foster care alumni first, and then all the other titles come after that, right? So I just wanted to place emphasis on that to begin with. Takora, you definitely killed it with the data. I looked a little bit at some of the things that we should be lauding, such as the reduction of the group care. I always think that when dealing with people of color, people always tend to approach us with what's good for the goose is always good for the gander, right? And they take this group approach, and I'm glad that we're getting the individual non-cookie cutter approach when it comes to modalities. So I really appreciate that. The only thing I would urge, well, two things, and I wrote it down in a moment, about mandating reporting. Number one, why isn't it that much data on mandating reporting? What is it? Who needs to come up with this? Right? Who needs to talk about it? Because I know with African-American youth, we tend to adultify them, right? We tend to, if you look at Ma'Khia Bryant's situation, everything went wrong from the mandating reporting process. We tend to, trigger outcome. When there's a report being put out, there tends to be this compassionless physiological bias towards our African-American children. So you might see a 16-year-old built like a 30-year-old, and in the descriptions of mandating reporting, they know how to trigger those safety responses. So I think that we tend to adultify our African-American youth. And I think it should be some data or some research centered around that. So I look forward to that in the future. And number two, I did want to talk about post-secondary education. Some of the outcomes when it comes to what the child welfare is doing towards pushing post-secondary education for our African-American youth, because from what I remember, of the 600,000 youth in foster care or child welfare system, there were only 10% that pursued post-secondary education. And of that 10%, there were only 4% that actually achieved that post-secondary education. So that's pretty big to me. And I think that pushing the conversation forward, I love and I want to laud all the great things we're doing, but I'm also here to just try to challenge and shake some pillars here too as well.
If we have another moment, I would like to address the trauma to triumph part.
Thank you. Go ahead.
Yes, I'm reminded by Jamar that I don't mention my story much, but I graduated from a congregate care facility. Can y'all hear me? My daughter finally decided to clean her room, and that vacuum is
We
going.
can hear you.
Thank y'all. I don't want her to stop. I don't want her to stop.
Go ahead.
So, but yeah, so I graduated from a congregate care facility a year early, out of with no permanency, right? So I've been on my own. I needed the safety removal, right? But I've been on my own in a system as a parent, back in the system with my children. We are out here and we are here. And I claim my triumph because I don't need anybody to tell me that I made it, because nobody was there telling me that I didn't make it, right? The whole world was telling me that you couldn't make it. So I just want to reinforce that triumph part, because every day you stand up and say something is a triumph. Every day you put that lump in your throat into your work, that's a triumph. Every day you step up and remember those, right, who have not a place here to say the things that need to be said. That is a triumph. So be encouraged, each of you, that every time you think a little differently, every time you approach a problem a little differently, every time you allow someone's humanity to be seen, you are creating triumph in yourself and that person. So keep doing it, because we are here and we are changing things and we are doing things. And thank you for having us.
And thank you for being here and for working alongside us, for setting us straight on who you are, owning your own story, right? So thank you, Jamar, for sharing your take on what we say are lived experts. You reclaim your story. You tell us how to refer to you. And that is what we all deserve, right? So we appreciate you being at the table. So Peter shared a statistic with me that bachelor's completion among foster care alumni are about 8 to 12%, which is much less than other young adults, right? So thank you for that, Peter. And you're absolutely right, Jamar, that we need to be pushing a number of things, including post-secondary education. Thank you for that. Thank you, Ms. Takoria, for your transparency. Thank you, Dr. Pecora and Lisa, for sharing this data. As Dr. Pecora mentioned, we will have a follow-up drill down session on the data October 5th. And so everyone who registered will receive an invitation to that webinar as well. Okay. So with that, I will end this portion and turn it over to Mr. Michael Finley from the Burns Institute to talk about painting a canvas of triumph. What would or should a canvas of triumph look like for African-American children, families, and communities? Mr. Finley?
Yeah, thank you. And just, again, Mike Finley with the Haywood Burns Institute. Just want to shout out my colleague, Sam Mellerson, who I think is somewhere on this call. We work, I know some of you, and work with Keith and others, Korea, Angela, other folks, and part of the Thriving Families Network. And so that's how we I think we're invited here to play a role just in moderating, but just appreciate all the comments. This feels like home. And so it just feels good. So just appreciate this discussion. And my job is to hopefully mostly stay out of the way for this session, which is painting a canvas of triumph. And I think, as we talk about these issues, it's a lot and it's hard and it's, and it's often easy to sit in the funk. And I think part of what I'm doing this session is talk about what does it look like? What do we want? What do we need? What do we have to have? And I think it transitions from all of the conversations earlier. And just to know from the Burns Institute perspective, and I think this is a lot of the framing I heard from other folks, we are in a uniquely but not uniquely crazy, politically divisive time, right? I think it's gross and ugly, but I think as every generation could speak to the gross and the funk and the stuff, right? Particularly as Black folk and people of color have had to experience, but we are in a particular time. And part of our work is how do we build bridges? And it's hard because in all transparency, you don't always want to build bridges. And then the question is, what are you building bridges to? But that's the work. And as I listened to Ms. Walker, and then actually Tokoria referenced it, at the end of the day, right, these are human issues. These are bigger than just a particular grouping of people. And I think folks have mentioned, how do we center humanity? How do we center ourselves in this work in a way to move forward? And again, that is hard. It means sitting at tables with folks that you're not always aligned with, do not always agree with, that have been harmful in your existence, right? And so this is the stuff we're trying to figure out. And so today's session is to give some time to that. And again, I'm framing that to say the perspective I'm asking questions that I'll be facilitating is from that. How do we create the bridge? How do we bring this together? How do we put those who should be in leadership and guiding these conversations or the work? How do we do that? So with that, I wanted to introduce just by name the 4 people who will be the panelists, and then I was going to ask a question. But as folks talk, Jamar, I'm struck by, right, when you're saying hey, I'm a Foster Youth alumni, that's what I lead with, and I want to respect folks, how folks want to be introduced. So I want to make sure folks know who the names are that will be on this panel, and they're all here: Tiffany Boyd, Christina Romero, Jamar Jones, we just heard from, and Sharina Parker, who spoke a little bit earlier. And so those are the 4 folks that are on this panel as we talk about painting a canvas of triumph. And we had a pre-call talking, folks, that we don't want a script. We're not doing a script. We're having conversation. And so my job is to put out a question, and then we'll talk and we'll have discussion. And my only facilitation, if folks go a little long, I might say interject, but really want to hear from folks. And one of the first question I wanted to put to the 4 of you is it might seem super simple, but I think it's just important to do. And that's to say, from the perspective of folks who have experienced the system, who are working in these systems, what is it that you feel you bring, right, to this work? Like, what is the thing? What are the things that you feel like, hey, for those of us who we can tell the story in a very intentional way, what is it that you feel you bring to this, right, that people need to understand there's a value there? And I'm going to open it up again to the 4 of you. And I'm also happy if in your opening, if you also introduce yourself very briefly, just however, you want to be referred to, because I want to respect that. So what is it that folks who have been impacted by systems, as we think about these conversations, do you think you bring, that you bring, not think, that you bring to the table? And I'll open it up to the panel. Tiffany?
I'm happy to kick us off in this discussion, but come on, let's be real for a second, Michael. We've been having church all morning and paying homage to that. I just want to pay my tithes real fast because Mr. Burton, that bar you said about leadership and the definition of leadership that was shared with you really struck a chord with me because you don't know, and you would have no way of knowing that I really considered putting in my professional resignation from the game of child welfare this morning. That I dropped off of a call, which was like my virtual version of storming out of a room, real dramatic, and sat here with tears swelling in my eyes, honestly considering taking my talents, my ideas, and everything elsewhere, just being so tired of being disenfranchised, not just as a woman of color, but as a foster youth and as an individual whose voice I feel like is being used for everybody else in the room to get what they need. And I was considering things and going through things, and I was listening to you. And the second you talked about this title, right, that I walk around with as a leader, being what I get for the price I pay of standing in those moments and standing in that discomfort and having the lumps in my throat, like I got a little bit of one right now, like not only was that a bar, it was so necessary and so needed. And you were in that moment really reminding me and reinvigorating something in me. Like y'all said, a spark that's about to set a whole fire over here in LA, and just don't even realize how much of a sermon we have been having this morning, right? How timely and how necessary. Then don't get me started on MC Dr. BJ Walker and the 16 bars that she came and spit after that. I am in awe of everything we got to hear today. And I hope that my comments will stand in comparison to the greatness that we just heard. Cause like I got notes, y'all. Like I'm really over here like writing stuff down. But to speak to the point and also to tie it to something that Jamar just struck up in my head as he was speaking, and shout out to the passion, bro, because I feel you. But as one of the people who was in the room, when we attempted to coin the term system impacted lived experience expert, the conversation was that we're tired of being, well, as an individual who's a part of that conversation, my position was, I'm more concerned with how they see me and how they pay me than what they call me. And I'm brought in room with other people who are considered experts based on whatever degrees and whatever gravitas they have, and we are not seen with that. We had no way of establishing our gravitas beyond the experience of our parents, and the term that they had at the time was former foster youth, and ain't nothing former about my foster status. My mother is not schizophrenic anymore because I emancipated from foster youth. So I hear you. But our conversation was about the right to be called what we want to be called, and the right to be called something that'll get us to the next level of where we want to be, because we're a part of a system that'll use us to get where they want to go. But forget that we have desires and hopes too. Ms. Walker, when you said to the convenience of everybody but the family, that bar right there is how we function as a society and as a system. Nobody's looking at our dreams and our desires and realizing that sometimes we have to work ourselves out of the way to get those people there. We have to put ourselves out of a seat in order to give them the seat of where they belong. And that reality is not lost on nobody here that's a part of this conversation today. And I know we know it. And as lived experience expert, as I like to call myself and want to be paid as such, want to be respected as such, want to have the gravitas to come into a room. And boy, and as such, I say that with compassion that I will refer you to whatever you want to be called, bro, and whatever meets your needs for that. But to the point that Peter made earlier, see what happened was the people who came up with the idea, right, aren't the people who are setting the tone for the conversation. And something gets lost in the process when people come in, where people are finding solutions for themselves and they poach off of those solutions and those ideas and formulate them into their own ideologies, right? Twist them to fit into a system where it doesn't belong and create their own versions of those things. So somehow it got watered down, right? And somehow we're not even lived experience experts. We're LE capital lowercase x. So I feel you, bro, because I'm not being called what I wanted to be called neither, right? But the reality is, again, I'm more concerned with the way they see us. And to answer Michael's point, I'm a professional with a degree. You can call me into any room, and I'm good to have in the room because of the way my brain thinks, being a not just survivor of a schizophrenic mother, but one of 7 children who possesses the ability to see things, find solutions, and really be a go-getter. Aside from my degree in public administration, aside from my degree in speech communications. So if I call myself just an alumni of the foster care system, in your case, which I get that, it belittles the professional that is in me that's in these spaces that wants to be foster youth correspondent. You was right there when I came up with it, right? Lived expert correspondent. Watch people start using it. Watch it go somewhere. That's how these things happen. But the reality is, Lessons has the emphasis of the conversation that me, you, and everybody had about when other people come into spaces and they give their opinions on things, they're called correspondents. Why can't we be called correspondents? And we talk through what kind of correspondence we want it to be called. That type of action is important. That's the type of innovation that we bring into the space, not just the ability to speak for ourselves, but to represent our communities, to represent our parents. And our innovations are not limited to, or only stemming from, should I say, our lived experience. Because I have 9 years of lived experience in the system, from 9 years old until emancipating, to now being at 36 and have started advocating at 19, I have more experience on this side of it as an administrator than I do on that side. And so to just capsulate it and close out my point, because I know I got to share this space and I don't want to go on and on, with some of the things that were brought up today that really, really like stuck with me. We really cannot forget where we come from while we're in the process of being paid to represent them. And I used to call them passion and poverty pimps, but I am taking that merchants of trauma and I am running with it, because that is not just a more fitting label. It's more politically correct and it's super, super important. And the only way to combat work for and sleep at night a merchant of trauma is to become a merchant of change and triumph, right? So I bring the ability to be in a room full of merchants of trauma and have never, not once, not only become one of them, I have remained a merchant of triumph. So I want to personally thank Mr. Burden, because I'm on my leadership tip and you inspired me, I promise you. That really, really set a fire to realize that leadership is not only earned, that is a price that I have paid, and a title that was not bestowed on me because somebody decided to coin me a leader, but something that I've worked for and I have to continue to work for. And my feelings being hurt today and being felt, all the things that I was going through this morning does not negate me from the reality that I have to stand, I have to fight, and that this is a bigger conversation. And so thank you so much for that. And I think that we are moving towards a space. There is some good news, but like Takoria said, it's wrapped in the reality that we ain't with nowhere. Our families are still being affected. And we are in spaces and places, and our ideas are in spaces and places that we are not welcomed. And that's the unfortunate reality, is we bring the ability in the room to work everybody in the room out of the room, and that scares some people. That's what we bring into the room. The ability to solve our own problems, to heal our own families, and to do those things. And unfortunately, it's disrupting a system that was built, gets paid to, and functions off of keeping us in those positions. And I'm gonna stop right there, but thank you very much for that time.
Yeah, no, thank you, Tiffany. And I just appreciate that piece on innovation, not just based on your experience, based on everything. Experience, you said, yeah. And I also had a whole bunch of years of doing this work. So appreciate that. Other folks on that one?
So I also just wanted to jump in, and I appreciate Jamar and Tiffany so far with what they poured into this piece for us. And me personally, I don't accept titles. I don't accept boxes. I push back on them, and I love the fact that you all are pushing back on them. But even the term lived expert correspondence, I push back on that, right? I challenge others to push back on those terms: lived experience, lived expertise, lived expert, right? Because when we hear those terms, what pops up for us and for others is the memory of our experiences, right? And those experiences are associated with us being impacted by these systems. So I am, and thank you, Michael, for giving me the opportunity and us the opportunity to introduce ourselves, right? So I'm Christina Romero, a parent knowledge curator with Mining for Gold. So that is the title that I go by, I live by, I work by, right? I add value, and I feel like we all bring value as we're doing the work, because we do bring the voice, right? We don't sit silent and see harms that are caused to families and not stand up to use our voice to say those things, right? We make sure that we are vocal. We give in the moment feedback. We evaluate practice. When given the opportunities, we look at policies. So those are some of the values that we bring, in spaces that we are in.
Thank you.
Michael, I'll go in here too as well. Thank you so much. Thank you all too. I'm seeing the comments. You guys are on fire. And it's the second half of the day. So shout out to y'all for still being here and still being up. I think that we bring an array of things. 4 things come to mind. Number 1, authenticity. I think we're truth tellers. I think that we intentionally power share. And then lastly, inspiration. I'll get into the first one. I think we're authentic because we didn't choose to be here. It's not like our traumas. We wanted this from birth, right? We are here because this is a choice. We choose to be in the leadership roles or in these experience roles and share it with you all or everyone that's on this call today. Number two, intentional power sharing. We honor and embrace other people's perspectives. I know all too well, all of us been in different places where your perspective isn't respected. And I hit out. I don't go in places where I'm not being respected. So I think that with Foster Youth alumni, everyone I've ever met, they love to intentionally just power share, no matter if we're leaders, no matter if we are on the road to leadership, we just like to power share. With truth telling too, we know that we don't have a dog in this fight at all, right? We don't have a puppet master. We are not puppeteers. So, you know, nobody pays us to give us these words that we say or give us these experiences. We come from a genuine truth-telling place. It's unmitigated. It's uncompromising. It's unapologetic. So I just love the fact that every time I meet a person with lived experience, a foster youth alumni, a correspondent, a parent knowledge curator, or whatever we are, what we want to be called in self-determination, the three factors in truth telling is they're unapologetic, they're unmitigated, and they're uncompromising. And you're going to get that. And last but not least, we are inspirational. We are people of rhythm, right? We like to move a little bit, and that's what inspiration is. We're people of riz, right? We got rhythm with us. So part of our educational route, where all of us, well, for the most part, people that get into education, we're 100% serious about the information we disseminate, but we also have to have that inspirational part, that rhythm part, that riz part. So I think that we have those four things: authenticity, truth telling, we are inspirational, and we intentionally power share.
And I would just like to add really quick that I'm glad that I get to choose how I want to identify and represent myself. Through my trauma, I was able to overcome it. I certainly don't go around, expecting tokenism or exploiting my story. I get to decide, depending on the room that I'm in and what's going on, how I want to identify myself. Just being in child welfare has been conflictual for me for the past 10 years because you of course get trained on the policies, but being a lived expert or having lived experience, that's something that that experience can't be trained or taught. So I get to, use that to, help others look through other lenses to see things that they may not always see. So sometimes I may have to go there. I walk around, I wear my professionalism because, again, not wanting to use my story as a tokenism thing, but sometimes I do have to get on that level and let people know that, outside of this, I've experienced this, I've grown through this, and my experiences have qualified me to be at the table, to be able to speak to you on another level that you may not always be able to understand.
Thank you, Sharina. Appreciate that. And I mean, I feel like this is a little bit of preaching to the choir, that question, but I also feel like it's important to name these things and put them in the room, and just wanted to hear folks, explore it in such a powerful range. And it's feel and it's substance. I mean, it's everything. So I appreciate that. So one of the things I want to spend some time on is, I feel like around the country we hear it, and you all have experienced this. I mean, it's the challenge why we're talking about these issues. It's the challenge of, so when we're talking about reform or transformation or real impactful change to these systems, right, which are so problematic, and who's making those decisions, who's at the table, and we constantly hear, and this has been discussed much in Thriving Families, right, the relationship between system stakeholders, those decision makers, and everybody else, right? Folks who've been through system, folks who have experience, folks who are impacted by the system, community folk, all those other folk, right? And wanted to just hear from folks about how do you see the challenges, but also I think and we can start there, but where I want to push to is then, what does it look like to be different, right? And so just want to started with, what do y'all feel like you're bringing? And then let's talk about a bit like, there's this constant challenge thing, right? Where it's as if, I don't know, and just want to hear how you talk about how you see the challenges. as I started with the bridging gaps and bridging the divide, like, but you know, hearing them from all sides, like, what are your thoughts, and like, what is some of this about? But also, how do we try to, what's needed to overcome some of that? And hopefully that makes enough sense for folks to respond to.
So I just want to go ahead and jump in, right? And I think that, you know, in the mix of some challenges that I'm facing with hearing that, right, is we can only comfortably talk about triumph once we talk about abolition, right? So from my perspective, triumph is abolition. It's creating the conditions needed to eliminate punitive ways of breaking families up. So in a few ways that, you know, we can eliminate those challenges is, especially within child welfare, is ending mandated reporting, right? Centering the experience of impacted people, ending child abuse registries, ending the coalition of poverty and neglect, you know, limiting state authority to separate families, and ending the punishment of pregnant and parenting people, and creating supports that are outside of the family policing system. And, you know, just highlighting that piece right there, some of the, you know, challenges that I've witnessed in the mix of collaborations between system stakeholders and those impacted is the mindsets and the conditions are not there, right? They're not in place for us to partner effectively. So there's really no shared vulnerability. When you jump into a room, an impacted person is asked to be vulnerable, but you don't actually receive vulnerability from the other side, right? The readiness. We could say we're ready all day to partner and do these things, but are we really ready to partner and do these things with folks who have been impacted by these systems? And, you know, Jamar mentioned it earlier, that shared power. I see that it's difficult for folks to have shared power with somebody who is impacted. Like, what does that look like if we're painting a canvas and it's starting off, you know, with nothing on it? And I visually see the need for parents to be a part of painting that beautiful masterpiece, and we're just not being included. And, you know, another challenge is the sitting in silence, right? We see system professionals that witness and see the harms that are being caused to families, and they're not stepping into their power and using their voice to make sure that this doesn't continue to happen to others.
Yeah, thank you. Not small challenges, but appreciate that. And don't be locked in. The question is big, small. I mean, it's, you know, as we're thinking about challenges, then we're going to keep moving, and you've started to identify some of the fixes, but we'll dig into that. But yeah, I just want to not have people be boxed in.
Yeah, I just want to take the opportunity while we have all these child welfare executives in the room to speak to the us, we, they, them of the conversation. But before I do, I just want to remind y'all that I know what I just said, right? And I know that mic drop moment that I just had, and I stand on it. And I stand on the fact that I am triggered right now. It's all these things I'm going through today, and the reality of the passion that comes with, and the fact that I don't want to scare y'all away from the point that I'm about to make, right? The reality is, I think there's a us-them divide in this world, to where sometimes the child welfare professionals can mistake us being for something from being against them, right? And I use as an example kind of my relationship with my brother as I help co-parent my nephew with him versus taking him from him, right? And saying, well, I can do it. I do the bulk of it. Like, I have the whole parental, but I'm letting him keep his rights, not just in namesake, but in understanding that that's part of how this can work. He's adamantly convinced that anything I do for his son is against him, right? So if we're advocating for foster care reform, if we're advocating for the rights of foster youth, if we're advocating for these things, sometimes you can be in a position to where it can feel personal. It can feel like, because we're talking about your position or your job, that we're coming at you. And I know that that's not the reality. And in order for us to get to the next phase of actual change, that there's going to need to be some cohesiveness, because I was thinking about the reality of whether or not you have system impacted lived experience and expertise, or whether your lived experience expertise is based around serving families, which was the rest of that conversation, which was we are all experts, right? How do we all get to be called experts without it being a us, them? We want to be system impacted experts. You guys get to be, insert your term, experts. I just want to speak to the reality that we're going to have to find ways to have those hard conversations, right? And for us to get along, because sometimes it's not the white people in the room that I'm having problems with. Let's be real. And we're here having this conversation with Black professionals, and sometimes we're put in a position to where our administrative position can conflict with whether it be our reality of representing lived experience, or representing the Black community. And going back to when we're working for these merchants of trauma, right? That reality and the fact that so many people can sit here and not just want to borrow that term, but we're all snapping and agreeing to it. But those are the people who sign everybody right here's checks in some way, shape, or form. And if even if we fancy ourselves or romanticize ourselves as breaking it down from the inside and doing all of those different things, you have to work twice as hard in that reality. So first and foremost, I commend y'all for still being here and not quitting, because I'd be wanting to quit sometimes too. But then I want to encourage you to really look past the lens of what your role is as an administrator and put some humanity back into this bureaucracy, right? Because we're in a very bureaucratic system to where somebody said earlier that they hide behind, what did they say? They hide behind policies. And I was like, I clutched my pearls. And y'all see, I don't even got no pearls on. They said it. That's the truth. When they don't want to have the hard conversations that we don't want you here, we'd rather take your ideas. And when they say, oh, no, we can't do this because it is policy. So when we're standing as the people who are representing the policy and the bureaucracy, our jobs are twice as hard. So I speak to you not just as a foster youth correspondent today, or a foster youth professional, or foster youth alumni, or a former foster youth, or any of those different things, but as professional, like, let me put on my commissioner hat that represents the county, and as somebody who stands in this bureaucracy with you, I think we have to kind of get past ourselves to have a really, really deep conversation about how we can go the extra mile, how we can get outside of the box and all be the BJs of the world that some of us wish that we had, right? Like, we didn't have BJs, but we can become those people. So I just want us to imagine, right, after we have that difficult conversation that we're going to have, imagine how we can be that type of person that people all these years, she said 2005, she ain't seen her since, and she's still raving about this woman in 2023. That is a life-changing impact. Like, how do we become those type of people in the world and spark that type of change in somebody's personal life? She didn't just change her situation at that time. She changed her in helping her become the woman that she is today. And that's what she spoke to. So I just want to encourage us to do more of that too in our process of being merchants of change, and trying to, whether you want to reform the system, whether you want to dismantle the system, I think we can all agree without having to get into like the scrap of it all, that at the end of the day, the system is not working. And if anybody has access to do something about it, it's every single one of us.
Thank you, Tiffany. Appreciate that. Anything
Serena,
else
you
on?
wanna-
Yeah,
I had
you got
something,
it.
but Serena, you want to go?
Oh, no, you go ahead.
Okay. I vehemently agree with Tiffany too, as well. The divisiveness between, those with lived experiences and those with power too, as well. I think there's a meritocracy issue, and I'm just throwing this out there. There's this meritocracy issue. Sort of like in professions where you see like licensed professionals versus the ones that don't got license. Okay, we all are doing the same type of work. So anybody that's a nurse practitioner out there, or an APRN, or a social worker, there's this consistent unspoken, or those with a license are those that are more professional, or those that can get the most work done, when we know in reality and practice, we're all on the same mission. I always use the analogy, and hopefully you guys follow me, or I guess the breaker when I work with young people is, if you put 100 people in one room, you tell them to point, and the mission is to get out the room, and you tell them to point with their eyes closed, they're not going to get out the room. Only like 2 or 3 may get out of it out of coincidence, but they're not going to get out the room. If you put 10 people in a room, tell them to cover their eyes and tell them to, get out this room, but point towards the door. Each one of those people will get out the room. They might have to change their pace. They might have to slow down. Somebody's going to be in front of you. And I think that's part of the collaborative effort that we need between stakeholders and people with lived experience. Frantz Fanon, who was a psychiatrist here in the state of Maryland, in Baltimore, and he was a friend of Malcolm X, by the way, he said that every generation has something to offer And he says, every generation must, through relative obscurity, we must help them fulfill or betray it, which means no matter how big or how small, whatever people have to offer, we have a job to help people fulfill their destiny or betray their destiny. So I just want to just drop that mic right there. Thank you.
Thank you, Jamar. Now y'all dropping lots of mics today. This is good. I didn't know if you had anything to add on that. I just wanted to make sure we gave you an opportunity. If you did, I see that you muted your screen, so you may not.
Yeah, sorry, I was
And
trying
just
to fix
as
my
we're sort of
connection.
looking at that, so
Yeah.
oh,
We can
you're
move
good.
on.
You're
I was
good.
having connection issues.
Okay, sure. So now, so I think let's spend some time, right? So, and Tiffany, I appreciate the language you said, right? We need cohesiveness. And then later you added in, right? We need to add humanity into this because that's right. That's so absent from so much what we do. And I would add, so it's just common sense, right? Like there's just a way people professionalize things that it just literally becomes void of all the things you do in your regular life and how you talk to people or how you are when you're younger, those kinds of things. And so wanted to, and then also the issue of, right, these are structural systemic issues. And so regardless of who the faces are in those positions, right, often they still perpetuate the same oppressive stuff. And so wanted to spend time, what does it look like as we're thinking of painting a canvas of triumph? So now let's flip it, right? And that's hard. And I'll just, it's hard, but let's spend time like, okay, we're identifying what the stuff is. How do we get to the cohesiveness? And I apologize if I'm frozen, I had a little instability, so I'm hoping you can all still hear me. But what is needed to get the cohesiveness? What can we put in the room to say, how do we get to a place where we're actually putting humanity back in? And just wanted to hear from you all, just again, thoughts, perspectives on that.
I can go first. I just got an ambulance right here. I'm just trying to wait for it to pass. From what I've seen works, I'm just going to emphasize the shared leadership. I think there has to be some re-education in what leadership really means. If you're a stakeholder or a person with power, leadership, I listen to a lot of leadership podcasts, and what stands out to me is a guy named John C. Maxwell, right? I'm pretty sure some of you all know. And he talks about how leaders build other leaders. He says that you have to have influence to be a leader. You can't just be a positional leader. So those that carry the title, position is just the position is a place you want to be, but not a place you want to stay. You then want to go beyond permission. He talks about 5 P's: permission, leadership, people development, productivity, and pinnacle, right? You want to get into the permissive leadership. And I think I see that I guess the deficit is that a lot of people in positions of leadership have no influence. They're positional leaders. They're not permissive leaders. They're not people developers. They're not productive when it comes to what the community needs. So I think that, and he said another quote, I have a lot of quotes in my mind. He says that if you are a leader with no followers, you're just on a hike. What else he say? He says something else like, if he who is leadeth and no followers is only taking a walk. And then he says a whole bunch of stuff. I'm just getting real silly after 2 o'clock. But yeah, I think that we need to recognize that positional leadership isn't going to do it. We need shared leadership. We need shared power. I can recall a time working in a Freddie Gray community here in the city of Baltimore, which is more like the Winchester community, as a therapist, and seeing the trauma in the community post Baltimore riots, and how I had to recognize that the person that had the positional title had no influence. I had to talk to mama such and such from down the block who had the influence. That's who I need to be talking to. So I think that in recognizing that you know you got the power, we know who you are, you're in your position. You also have to develop people, you also have to have that permissive leadership, and you also have to show some productivity. I'll land the plane there.
And then I would also say, you know, creating a seat at the table. I spoke a little bit about, you know, Commissioner Walker at that time. You know, she was one of the first commissioners in the state of Georgia that I knew at that time that actually welcomed, you know, young people to actually come into her office and actually listen to youth voice and the struggles that we were going through at the time. But not only did she do that, she actually put action behind the things that she said that she was going to do. So it wasn't like, I'm gonna just listen to you guys' stories and then I'm just gonna move on and then incorporate what policy says I should do. It's more like, I'm gonna partner with you guys and we're gonna help create change together. Mr. Bostic taught me to be bold and courageous. Even though I'm, you know, nice and professional on this call, I've always been what you would consider sometimes a rebel for change. Like, I'm the one that speaks up if I see something that is not being represented right. I don't mind challenging policy when I feel like it's not in the best interest of a child. So if you are, you know, in that leadership role, creating space for that person to do so. Sometimes people don't allow a person to speak who is not conforming to whatever policies they're trying to put in place. And then I would also say, get out in the community. I was hearing the gentleman speak about the data. A lot of times we have providers and stakeholders that don't even go into the communities and speak with the families or actually observe to see what's going on, and even inviting those people to the table. So that was just some advice I had.
No, thank you.
And I just want to chime in real quick, Michael. So, you know, hearing Jamar and Ms. Parker, and it leads me to that piece of investment, right? And really, when you are looking to partner with folks who have been impacted by these systems, investing in their development and in their growth, right? So, for instance, when I started my journey, I met Corey Best, the founder of Mining for Gold, and not only did he believe in my ability to be a leader, he invested in that, right? He invested in me taking trainings, invested in me being able to develop, right? And to have the opportunity to come and speak on panels like this and not resort to just telling a story of my trauma that got a door open for me, right? But really developed into my leadership and supporting, you know, me as long with education on liberation, advocacy, healing, anti-racism within my, you know, consulting and all of those things, to where it made me become a leader within my community. Not only spaces that I shared with, you know, system professionals, but really being able to be in my community and uplift the voice of others, right? And really taking that investment, the seed that he implanted in me of investment, I'm able to invest in other community members, you know, to uplift them so that they can become future leaders. So when we're thinking about, you know, things like that and what we could do to support those with who have been impacted, a key piece of it is the investment, right? It really has to be the investment. It's investing in them so that they can develop, so that they can grow, so they can have other opportunities that, you know, otherwise would not be available for them.
Thank you, Christina. I'm laughing. I see Tiffany over there. You want to add anything?
We gotta go, Michael. I know you got a job to do, but it's some bars coming out, and I am feeling inspired by this panel right now. I am in awe of what's being said.
We have time. We are good on time, so we are
you know,
good.
I spit that one out for the suggested question too, so I just wanted to open up the floor for everybody else before I came in my tidbit. You know, somebody prepared when they suggested the question. All right, so no, all jokes aside, Jamar, that bar on supporting our destinies, right? You made me think about that question that asks all professionals, how much did they pay you to forget about your own dream to help them build theirs, right? How much did they pay you to quiet that voice inside that just thought that you could do it or knew that you had something to build or something to bring the world? And as professionals, we all cross that path sometimes, because you can't pay bills with passion, right? Passion don't pay bills, right? But when there's a professionalism behind that and you put yourself in a position to create change, right? My grandma taught me that this was the civil servant section of the world, that there's supposed to be a class of people who really chose the professions of doing something, right? And being of servant to the people. And I think child welfare is one of those, right? And so for the what can we do part, not just help people invest in their own dreams, not just help get them to their destiny. Sometimes we forget to ask people because we're so busy getting what we want out of them. What is your desire? Who are you as a person? And to genuinely get to know people and how we can support them even outside of child welfare. And what I had prepared before being inspired by everything that was just said and just being in awe of it, because when Sharina said about the seat at the table, and I was like, sometimes it requires a whole nother table. I remember my first shot at like the big leagues when I became the first foster youth to come out of the system and to be placed as a commissioner in the Los Angeles Commission for Children and Families. My first act was to create the youth commission that we have now, because the reality was one seat wasn't enough. And I found that out the first day I got there. And the expectation for me to represent everybody across the county was unrealistic, right? And so my answer to the question, outside of me responding to the 3 things I was inspired by, is can we live in the reality that if me, any one of our lived experience experts here, any one of our alumni of the system, any one of our former foster youth that are here right now, talked you through and taught you every single thing we know about trauma, about our parents, about our upbringings, you still could not go home and do our jobs. I can tell you everything I know about being the daughter of a schizophrenic mother. I can tell you everything I know about coming up through a system where people came into my house making decisions. I can tell you everything I know, and still that would not give you the ability to survive one day in this life. But if you taught us what you know, but if you invested the skills and the professional skills that you have into us, can we go into those spaces and do what you all do? Yes, but that investment is not being made. We're not being taught. The seats that are at the table for us are the peanut gallery seats where they wait to bring us to the big table or tote one of us, right? The tokenism of it all up there. And the reality is that sometimes that ain't enough. It's a start. It gets the conversation somewhere. But how are you choosing to be the difference to say, ain't no room at this table? Here goes a seat. It's a seat right here. My seat sometimes is the seat that people need, right? Sometimes we have to be that change to the extent that, like, it's almost impossible we know that our oppressors will never fund, right? Us being released from that oppression. Like, we're clear on that. We can say that and we can stand strong on that. But where do we stand in that analogy when we work for the oppressors? Are we in the way of actual, like, emancipation of our families from a system that was never serving us? Are we really helping guide people towards their dreams, or just using them for whatever our flavor of the month is that month, or whatever the topic of conversation, or wherever philanthropy decided was important based on data that people only went to look for based on the assessment they already had about a situation in the first place, right? So I just want to remind us that without lived experience, and not just without lived experience, I want to rephrase that. The innovations that lived experience brings into the building are priceless. And I want to leave you guys with this, and then I promise I'm going to shut up unless I get to talking again, but I'm going to shut up. It's almost the equivalent of, and here's my analogy I was thinking of. So imagine you talking sports or numbers with somebody one day, and you're giving them your picks on the numbers, and they're going back and they're going to somewhere they know about that you don't know about, and they're putting those numbers in. And they're winning. You're supplying them with winning numbers, because lived experience has supplied child welfare with winning numbers for a long, long time, right? To keep taking those numbers from those people and never teaching them how to go make the bets for themselves, never illuminating the reality that there's an entire system to where what they provide is not just a service, not just a resource, but is the glue that makes everything stick, and acknowledge the fact that they could not have come up with those numbers or them teams themselves. And that's where that poverty and passion pimp label that are now being retermed as servants of the merchants of trauma, which is what I'm now coining these people, because they don't realize what they're doing. They know not what they do, but that's the role that many of us, because I'd be on the admin side too, play. That's something to just chew on and really think about, is how can I be so far out of the box that I realize that lived experience is not just a token, that's not just a commodity, like that's a person that will one day be so successful that the very least you can do is insert yourself as somebody who helped them along the way, and not somebody who held them back or sent them home crying or made them feel like they didn't belong at the table and you did.
Yeah, thank you, Tiffany. Jamar, you're gonna jump in? Okay. That's how I feel. No, so I'm struck, I mean, and I think one of the things I'm struck by, and again, I'm shouting my colleague Sam out, because we always have these conversations and we're like, yeah, it is the common sense thing. And so as you're talking, right, leadership development, creating seats at the table or creating another table, right? And investment in people, it literally is like, right. And so if you were to ask any professional person in the planet, yeah, that's how you exist, right? People invest in you, people care about you. And so just trying to, the language of normalizing what we do for some people, but we just somehow choose not to do for other people, right? And how do we just continue to normalize this? So I just wanted to explore this a little bit more and just ask you all, because you're all in different positions, different places, do different work. But as we just identified some of the challenges, and as you are articulating, right, some of the things we need to do, how do you in your practice, in your personal, professional practice, how do you all try to do some of these things? Like, what are your strategies or tactics to try to bridge this divide? Because at the end of the day, there's still folks who have to be at these tables who make these decisions that, again, we're not always aligned with, but just strategies or tactics or things of how do you negotiate this in a real way in your personal work, and just, again, open it up to any of the four of you.
Mr. Finn, I'm going to ask you, can you rephrase that just a little bit more?
Sure. And thank you, Sharina, for not totally calling me out. You're saying that was a clunky question, Mike. Ask that differently. No, just like we've identified, this stuff is hard. You all are identifying all the various challenges. And I'm just curious, are there things you have done in your own practice as strategies of, right, so how do I, for example, influence person X who I know I need to influence? Or how do I create the new table and not freak everyone out, or do freak everybody out? And it's just what it is. You know, what does that look like for you all kind of in your daily practice and work?
Right. I think I kind of spoke to it earlier. It's kind of like, no matter what, being your authentic self, you have to be willing to be bold and courageous and willing to, step up and put yourself in that position. Like I said, in my role, it's kind of conflictual at times because, I am a child welfare administrator. I've been doing this for a while, but there's times when I have to be willing to say, hey, yeah, no, I don't agree with that. Or, hey, this is what I feel like is needed, even though it may not go along with whatever policies that you put in place. There's times when I've had to go back and forth with law enforcement, especially when it's dealing with Black parents, because sometimes they don't understand, some of the things that, in the way Black people raise their children, and they're quick to arrest. But a lot of times if I'm on the scene or my staff is on the scene, I will challenge them. And I'm willing to do that no matter what the consequence may be. So every day I choose to be the one that's going to speak up in my position.
Thank you. And that actually is powerful because, and I think it was Tiffany earlier saying, right, and there's also folks who choose to be silent, right? And so appreciate just you identifying that.
I was gonna chime in too, right?
Sure.
And it's also being able to have those courageous conversations, right? And going knowing that, some conversations will be difficult and they will be uncomfortable and it will get messy. But, really challenging folks that we work with to really do the mirror work, right? And to listen differently. And it comes from both sides, right? It's listening differently, being able to deepen the analysis on the structural racism and anti-Blackness within spaces that we are working in, right? Because we are moving towards justice, liberation, and belonging. right? And I, again, we'll go back to investing in people. When we're investing in folks, they will do more for the social uplift, right? So all of those bits and pieces kind of link together with the work that, I, do.
Awesome. Thank you.
I try to put the care back into human human services. I always say we have a foster care system that fosters our youth but doesn't care about them. So I think that putting the care into the in the practice that I do home, which is working for DHS or either doing therapy, I try to put the care. I believe it was Maya Angelou who said, people don't care how much you know, they want to know how much you care. So you can know, you can have everything on the wall, all the certifications, the license, but you might not have nothing on the ball. And I try to make sure that, the youth feel me before they understand that I'm, knowledge based about that. And I bring a sense of authenticity and I tell them to be your authentic self. I hate to be trying to figure out how I'm gonna deliver this, but I was watching a movie called House Party, and Bernie Mac said, if people don't care who you are, right? If people don't like you for you. And I'm just look at House Party 3. House Party 3. I just try to inspire them to just go about going along with, or not going along, but being your authentic self and putting the care back into this type of work, because as we see it now, it's all right now is maintaining the status quo. When you lock into a human service position, or you're getting into this type of work, you come in there with a passion to want to help someone, and then you leave. Well, you're currently just maintaining the status quo. It's about numbers, it's about caseload, service delivery, and deadlines, and all this stuff. So, and we forgot to be human in this type of work. So I try to put more of the care, authenticity to it. It's gotten me very far, by the way. I'm working on myself too as well. But yeah, I just try to put the care into this work.
Thank you.
Michael, I was just thinking about the softness and the insecurity and the vulnerability, right? And I'm one of those people, I come off like real strong, and I am, but that's earned, right? That was earned through the tears of the insecurity of really sitting there holding those feelings, right? And so part of how I combat all this is just still showing up. I can't tell y'all how much I did not want to come to this because of everything I had experienced this morning and the culmination of all of those feelings, and feeling like, you talking about like my life's work, and now you still playing me at this level. There was a feeling attached to that it's easy for us to find ourselves in, right? So when you're not encouraged, right? When you're having those times and we're in like the muck or the frustration of it, I think, Jamar, I'm telling you, man, you are inspiring me right now. I had to pull out this book, The Wisdom of Insecurity by Alan Watts. Is a book that I read years ago and that I'm re-tapping into now. And the mightiest things that I have done from the place of my inner child. I have done from the place of the little girl that will cry in front of y'all, and I ain't scared. Like, that sensitivity is my superpower. And I think that it comes off as other things, and people see it because you don't see the coal that I put into this. You only see the train on the tracks, right? You don't see me down there doing the hard work and what goes behind it, and how much work and insecurity that I have to battle through to be this confident, right? And all of those things. So just reminding us, like, it's the softness in us that makes us strong. And it's that hurting like child in us responding to those things and finding healing through this work and through that. So for me, sometimes it's just being honest, like, I'm not okay, and this is not okay. And I remember being ostracized as a child. Like, I was the one that was telling family business, right? Like, you telling people our business? I'm like, no, I'm getting help. Like, this is not cool. Like, no, right? And so that can cause a rift, right? That was at a point to where I realized that in order for me to get the help that I needed in order to survive, there were norms, right, that had been indoctrinated into me that, like, you would have thought that was my everything I knew. And I had to go against that in order to get that, right? So the courage that it took to do that came from a place of vulnerability. The courage to get to a table that's the place where everybody wants to be and say, like, this is not welcoming, this is not okay. And to speak to that, to get in a room where You realize they having meetings about your ideas without you, and to get on the phone and cry and say, no, I need to be there. Like there's it's not just the when we show up tough, because yes, we do that and we do that well. But let's remind them that it's not a fragility, but it is a sensitivity that fuels that. And I always remind people, I'm sensitive, I ain't soft. There's a difference, right? I'll cry and then I clock you while I'm crying. Like there's a reality to the fact that I am in tune with my emotions and choose not to be a victim to them, right? But we have to bring all of that in here. I could have showed up with my dress. I could have showed up with my commissioner. I showed up with my hoodie because Foster the Bear is my thing. It's something I want to put out there. This is my uniform. I'm so comfortable in my own skin. I can talk my own slang. I can be my authentic. I can talk to you the way I'm gonna talk to my mama if she come walk in this room again because I done told her 3 times not to, right? Same way I'll tell my nephew, he come walk in here again. It's that reality was earned. And y'all said something about leadership, and I've been looking at leadership all wrong. I was like, I ain't no leader. I don't want people following me. Who said that word? If you walk in, wait, if you a leader and ain't nobody behind you, just take it away. Oh, that was a word. Listen, I never wanted to be a leader. I never wanted nobody behind me. I got trust issues. Don't walk too close, right? So for me, I was struggling with taking the title of leader. My tears earned that. My showing up right now, despite the fact that I'm triggered, like somebody cue the song, right? Like but I'm here and I'm showing up and all of that vulnerability. And y'all think I'm so strong and saying all these dope things in the chat about me, but I felt my weakest this morning. I felt my most discouraged. I was ready to go home, take my toys with me in my house, y'all. But having the Jamars of the world, having the Christinas, having the strength, like we got something here. Takoria, you was talking earlier and you got to talk about data. And I was like, oh my gosh, she's so passionate about this. Like, I'm inspired. So part of it is about being around other strangers like you and realizing you ain't got to be the one. You ain't got to do it all. And there's other people out here who do care. And sometimes they get lost in the systems of it all. But at the end of the day, sometimes you just got to remind people like, hey, do you know you hurt me? Because they didn't notice it. Hey, do you know that that's not okay? Do you know that that's not cool? Do you know where I'm from? That's disrespect. Because sometimes they don't realize that's what they're doing, but it's the most powerful and most vulnerable thing that you can do to speak up, even when your voice is rattling, even when you got the little, I used to call it a frog in your throat. You still got to say something, right? Even if you feel like you're going to make a fool of yourself and might talk yourself out of a check or two, it's necessary, right? And then God will provide the rest. So thank you, Mike. I know I just jumped in on that little thing, but that vulnerability piece, that all of this comes from an insecurity of having to prove something and show something and do something. And ultimately, all of this is a reflection of our relationships with ourselves. And I'm proud to stand alongside, virtually or otherwise, these other mighty, mighty advocates and correspondents and professionals and humans that are here with us today. So thank y'all for this.
Yeah, thank you. And I think all of what you all just said also underscores this. Yeah, I love this space, like the need for these spaces. Because, I mean, Tiffany, everything you're saying, the exhaustion, the fatigue, the anger, the stuff. I'm looking at Takoria and Angela just through Thriving Families things. There's things, like there's just, this stuff is hard. And it's a weight. And you're not taught, oh, you should lean on other folk, or you should have these vulnerable, conversations. You should throw out your insecurities. And so, again, trying to normalize that, which actually is everything we're saying is being human. It's just being human, but you're not trained. We're not taught that. That's not something that's valued necessarily in all these spaces. And that's what we have to normalize. So I just appreciate everything you all put in the room. I just want to respect time. So I know we're near the end, and I just wanted to give one last opportunity, and do not feel any pressure. If anyone before you has anything else just you want to put in the room to the group as we get ready to transition toward our closing, but just wanted to give that last opportunity of no structure, just anything else you wanted to add. And again, appreciate everybody's comments so far.
So I just want to end for myself, right? And just to give that reminder to folks that it is difficult and it gets hard and it gets messy, but we still need to continue showing up, having these courageous conversations, supporting one another, investing in folks as they, as they level up and their journey, right? As a collective, united, we can move mountains. Individually, it's harder for us to accomplish those things. So just support, those that are working alongside of you, right? And continue to invest and continue to fight and stand up and use your voice and not be silenced.
Thank you, Kristen. Appreciate those words.
On the outro, I'll just say, if y'all can do it without us, please do it. I'd rather be at home raising myself, my schizophrenic mother, and my nephew. But if you're gonna do it with us, do it right. And don't miss the opportunity to be a part of greatness, because one day some people gonna look up and be like, is that the Tiffany from there? Is that the Jamar? Is that the Christina? Is that the Shrint? And realize their position in that path was not all that it could have been, right? So, like, you know, don't cheat yourself, treat yourself by treating us like humans, like your sisters and brothers and cousins and aunties and everybody else, because if they come knocking on your sisters and brothers and cousins and aunties' door, they might end up like us too one day. And so let's not wait for those 3 degrees of separation to get really, really close to home before we start having compassion, empathy, and understanding for other people. And last but not least, I was born Black before I became a foster youth. I was born a woman before I became a foster youth. And I think we often forget those things that we represent that are not chosen nor circumstantial. And as a community of Black professionals, I just want to remind us that we have something to represent before we represent our chosen profession, and just stand in that and whatever that means to you.
Thank you, Tiffany. Everybody good? Okay, I just want to make sure, Sharina, Jamar, if you're good, we'll we'll move.
I think Tiffany brought us home very well.
Awesome. So yeah, just appreciate you all. And I just think let's keep pushing each other, but keep having these spaces. And it's hard because we're trying to bridge a gap, bridge a divide, redefine some things, normalize some things, and not contort to oppressive systems, right? Not dancing when there's no music unless there's a reason to, right? I mean, that's what we're trying to do. And so just appreciate the energy you all have, and just hopefully folks felt energized by this, got something from it, hearing real folks on the ground doing the work. And so hopefully this was helpful for folks. So Keith, appreciate you all giving Burns a chance to just participate, and just I'm going to pass it back to you.
Thank you so much, Michael. Thank you so much, team. Wow. I will have I will have a lot to say in a moment, but I want to give my mentor, and that's BJ Walker, the opportunity to share her reflections from the day, and then I'll follow BJ.
Well, I thank you, Keith, for, giving me that much presence in what is a remarkable human being's life. If you don't really know Keith, Keith is, I don't even know how to say it. I talked to somebody, and we all just have a lot of admiration and respect for Keith and who he is and his authenticity. There was a lot of things that came up today, and I'm just going to touch them politely with my fingertips. The thing I heard across the board is that we got to all be more than what we are called and what people know about us. I don't care who we are at this table. We are all more than this. I love that thing in the Bible. We are more than conquerors. I mean, sometimes you don't really know what that meant, because to yourself, you're going, well, dang, I'll be a conqueror, okay? I'm good with that. But we are more than what we are called and what people know about us. So let's stay in that space, because that's the space where we can work across boundaries most effectively. I think it was Tiffany that gave me the Merchants of Triumph, but when I say it, I'll try to remember your name, because there's Merchants of Trauma and there's Merchants of Triumph. And across the span of the day, I've heard a lot about how we become Merchants of Triumph. And Tokoria, I think your challenge to Peter, and Peter knows that I love data and I love thinking about data. And so we take up that as we need to ask bigger, deeper, richer, different questions about the data. And so we need to carry that forward and figure out, we need to make researchers ask the right questions and look at the right data, not because they wrong or they bad, but because they want to be more than conquerors themselves. So I put that out there. I put this, and I didn't even get to talk about this today, but let's not forget that our communities are the folks who generated our children, our families. They generated us. And as long as we allow this nation to continue to disinvest and disrespect and not open up its coffers to invest in our communities, we can't expect our context. People out of context are, you're not good. And so our contexts have to be invested in. Let's put communities in the mix. They're the missing ingredient. And we need to make sure that those who have the power to do something on behalf of community. And it has to have dollars attached. Don't just come talking about having meetings and give me some pizza and maybe a little childcare, and all of a sudden you've engaged community. Not, we need community at the table, because that community allows all of us to collectively be stronger. Finally, I guess I want to say, this is a lesson that I have had to learn over and over and over again. Being right all by yourself ain't gonna be good enough, right? It just ain't. We have to create a space where people who are not right, but who are powerful enough to determine what right ought to be, we gotta give them enough room to change. And that means we gotta come to the table, even though we know we're right. When we bring right, we gotta bring it in a way that's redemptive and restorative for them. And that's very hard to do, because I just wanna get mad in a room sometime and tell them, you know, what I want to tell them and be done with it. But we must get people who make the rules, who make the politicians who decide what we have to do in systems, who determine whether you get punished or not for not doing the right thing. Those people got to change their minds. It's not enough for us out here changing our minds. They got to change their minds. That means we have to show up in that space in a much more powerful way. But we've also got to know showing up means that we're trying to convince people, and we're not just trying to be right, because it feels good to be right. I mean, I like it. It's a good feeling. So those are some reflections. I didn't know I would stay all day, but you all just kept grabbing hold to me. I had to go off camera so I could eat a piece of chicken from last night's dinner. And I just appreciate you, because you've inspired and given me an afternoon, and thank you for it. And Keith, I turn it back over to you, my brother.
Thank you so much. Thank you so much. Let me just first say that I appreciate each of you. And I have a lump in my throat. The lump in my throat comes from hearing each of you all, visualizing the journey and partnering with you. I think many of you have heard me talk about that. I partner with each of you all who are human beings who happen to have. You are BJ first, you are Christina first, you are Tiffany first, you are Takoria first, you are Jamar first, who happen to have. You happen to have some lived experiences that may or may not have been positive, or that may have been filled with lots of challenges. But I see you as partner. I see you as shoulder to shoulder. I see you as human. And so I start from that place. My lump in my throat gets even grittier when I look at the fact. I think at most we may have had 120 people to attend the conference today. I invited all 22 of the jurisdictions of Thriving Families for Safer Children. All 22 of those jurisdictions have huge child welfare systems and leaders. I'll have to go back and see how many, but I can assess, and I can surmise not many of those leaders who are those decision makers, as BJ talked about, who are those who are those fiscal agents and change and policymakers, and those who are void of any clarity around what data needs to reflect, sat here on this particular experience and opportunity. That's where BACW comes into place. It is our commitment to continue to have those conversations, to push the needle, to be in those places, to, as I say, I make major efforts to convince you to be a part of this effort and a part of this journey and a part of this transformation. If that doesn't work, then I attempt to compel you to be a part of this journey and this effort. That doesn't work. Then I move to convict you to be a part of this work and part of this effort. If I have to shame you into doing what is right, so be it. And so that is part of our role. That is part of our existence. That's part of the fabric of who we are as BACW. And I'd also like to say that let's be clear that the system is not going to correct itself. And that if we do look at history, the revolution happened in the communities. And that's where it's going to still need to happen. And so we have to band together, be collective together as we continue to move this and to support this around a human effort. The other couple of last things that I'll say, as BJ talked about, and many of you all talked about, that this canvas and this change must have the authenticity of the community, the authenticity, the involvement of individuals in the community. Because, you know, to me, the greatest data point, Dr. Pecora and Lisa, is a data point of voice. Oftentimes never gets captured, never gets utilized. It's very difficult to quantify because it is different for each and every person. But it's those voices who could tell you whether their circumstances have changed. I think we could find data that would say that there were 50 million widgets of services rendered to vulnerable communities where there are African-American children and families. And the data would say that folks went out there, they made connections. They provided this service or that service. But when I speak to families, when I speak to communities and I ask Ms. Johnson or Mr. Sam, what about that worker that came out? Or what about the systems that are supposed to be serving supporting? Oh, those folks, nice folks, they came out, they come out pretty regularly, and we talk. But Mr. Keith, I still have a leaking roof. Mr. Keith, I still don't have a lot of food. Mr. Keith, I'm still underemployed. I'm at the verge of experiencing homelessness. So one data set says that some system did extremely well. But when I have a conversation with the data point of voice, that story is totally different. And so we have to do better there. The other thing we have to do better is speak beyond the choir. I love each and every one of you, but this still yet is the choir. We need to invite those systems who, once again, have no idea that they have a responsibility or choose to not have an idea that they have a responsibility to this cause. Every school system in all those jurisdictions that we're talking about changing need to be at the table. 70% of all the referrals that come into child welfare are from the schools. They're not hearing this message. They're still pouring into and standing on the mandated reporter. And so they need to be active partners. HUD, many of our families are experiencing homelessness. They too need to look through race equity lens about what is needed and necessary, what supports might be necessary. Workforce development, all those places that we historically have not ventured into, or once again, invite or convince, compel, convict. Convince, compel, convict. And then one of the last things I'll say is that in every community. And I'm gonna challenge each of you all. You all are involved in many communities. Find your Mr. and Mrs. Smitty. Need you to hear me. Find your Mr. and Mrs. Smitty. Mr. and Mrs. Smitty reside in every one of our communities. And you know who Mr. and Mrs. Smitty is? That's the convenience store owner who knows all the people in the community. Mr. and Mrs. Smitty have probably been stolen from, robbed by people in the community. But Mr. and Mrs. Smitty could tell you the parental capacities of Mr. Sam, the parental capacities of Miss Jane, because they see, they watch, or whatever. But nobody's ever had a conversation with them to talk about, you know, what might be needed or what might be necessary, or what might be supported. So I encourage you to find your Mr. and Mrs. Smitty. And then lastly, I'll just say on behalf of the board of directors of BACW, and to all of you who have participated in this effort, we thank you from the bottom of our hearts. We are with you. We will continue in that journey from trauma to triumph. It's just not a one-off. Let's continue to do what is needed and necessary. Let us not grow weary in doing what is right. I love you. Thank you. Just a couple of reminders. On October the 4th, there will be a session to have more conversations around the canvas and about what conditions might be necessary for triumph to occur. Also earlier in the chat box, there is a date for the research follow-up, the data and the research follow-up. Is that October the 2nd?
October the 5th at
October
2
5th.
p.m. Eastern. Thank you.
October the 5th. You will get those invitations as well as the supporting documents that go along with those. So once again, I can't thank you enough. We appreciate each of you all. Thank you for your partnership. Let's continue to not grow weary in doing what is right. Thank you and have a great afternoon and evening.